Did you notice that this show doesn't have any commercials? I'm not selling you diapers or vitamins or smoothies or gasoline. That's because I don't want corporate sponsors telling us what to investigate and what to say. Instead, you're our sponsors. This is a production by our nonprofit, the Informed Consent Action Network. If you want more investigations, more hard-hitting news, if you want the truth, go to ICanDecide.org and donate now. Good morning, good afternoon, good evening, wherever you are out there in the world. It's that time to step out onto the high wire. Happy New Year, everybody. It's 2023 officially, and I have to say I had an amazing holiday with my family. Really just got to spend some time with the kids and my wife and enjoy just being together, having family. And I got to reflect a lot on just how far we've come. What an amazing experience this has been with my team, with the Informed Consent Action Network, our nonprofit, this show, The High Wire. And I was reflecting back to where this all started. I mean, back in SB 277, this law that decided that anyone that wasn't vaccinating their kids was going to have to vaccinate their kids in order to put them into school. Senator Richard Pan back in 2015 brought this bill. We were marching around the Capitol, standing up. I was just getting involved with Andy Wakefield and working on this documentary, Vaxxed, hoping that it would blow up this story around the world. And from there, you know, when we were fighting for it, we were being told, you're just a radical minority. There's only 3% of unvaccinated kids or 5% not vaccinated. Maybe 10% of you are vaccine hesitant. This must be quelled. This must be stopped. And then, you know, as we've all watched this entire progression, our discussions about vaccine safety, and then we hit the pandemic. And then if you imagine that it was a plandemic, then this is the biggest disaster that was ever planned. I mean a disaster on them. If they took about a 10% vaccine hesitancy group in America, we now know, and I've been saying it to you all along, folks, we're the majority. Stop being worried about talking about this. Stop being worried about talking with your friends. It's now official. Check out this Rasmussen poll that came out. I tweeted this out on Monday. Died suddenly. More than 1 in 4 thinks someone they know died from COVID-19 vaccines. You know, Rasmussen, this has been around forever. This is legit. Nearly half of Americans think COVID-19 vaccines may be to blame for many unexplained deaths, and more than a quarter say someone they know could be among the victims. What an incredible statement. They had a graph that they put up in this that really says it all. National survey of 1,000 American adults conducted in December 28th through the 30th. Percentage of vaccinated, the vaccinated that think there are legitimate reasons to be concerned about the safety of COVID-19 vaccines, 40%. 40% of those that got it think that there's a legitimate concerns. Percentage of vaccinated that think someone they know personally might have died, 22% of them. Almost 1 in 4 of those that got the vaccine thinks this is an issue. Percentage of vaccinated that think that unexplained deaths from the vaccine is at least somewhat likely, 38%. Percentage of Americans that believe there are legitimate reasons to be concerned about the safety of COVID-19 vaccines, 48%. And percentage of American adults that believe it is likely that side effects of COVID-19 vaccines have caused a significant number of unexplained deaths, 49%. We made this graph, by the way. This isn't how you read it on Rasmussen. We made this so that you could see it. But those are outrageous numbers. And I say majority because when you look at those against, it's in the 30%. Like 30% don't think that that's true amongst the vaccinated. We are now the majority discussing these issues. Now, this was the biggest story, I thought, maybe certainly throughout COVID, this pandemic, maybe in my lifetime medically. We have never seen this big a shift around a vaccine conversation. But then on Monday, just hours later, one of the biggest news stories to sweep America hit. This unfortunate story is what we all witnessed in the news.
A terrifying scene playing out on Monday Night Football in Cincinnati.
Terrifying moment involving Buffalo Bills safety Damar Hamlin.
The Bills say the 24-year-old suffered a cardiac arrest.
24-year-old Damar Hamlin collapsed on the field after making what seemed like a routine tackle, suffering cardiac arrest.
The injury is sending shockwaves through all levels of sports.
It wasn't until you looked into the face of the players and saw their reaction did you realize that this was something extraordinary.
When I saw this hit, immediately I knew it's not the hit. right? I mean, that was a standard hit.
Don't recall ever seeing anything like this. To see him make a tackle, to get up, and then literally collapse, then his legs start shaking and what have you. It was scary.
Never seen a response from a hit like that, Anderson. There didn't seem to be any direct hit to the head or neck area.
Been involved in this game for 55 years as a player, a high school player, college player, professional player, and as a coach. And never witnessed anything like this.
It was a collision you see dozens of times in any NFL game. Hamlin was treated on the ground for 20 minutes before being taken to a nearby hospital under police escort.
He was transferred to the University of Cincinnati Medical Center for further testing and treatment. He was currently sedated and listed in critical condition.
Medical experts say the key to Hamlin's recovery will be how quickly his heart was restarted.
Really, it's going to come down to his underlying strength, his conditioning, and how long he was without any oxygen.
First of all, I want to say that this is an absolute tragedy for those that were watching football on Monday night. I think we are all in shock as the teams that were involved. The game has been postponed from that moment on. I also want to say our prayers are with Damar Hamlin right now as we're praying for a complete and speedy recovery. Just really hard to wrap your head around what took place there. But that is what, especially since on the High Wire, what we do is discuss health. We consider ourselves in many ways a health news program. And I think that this is an important issue because in some ways, it doesn't stand alone. We have been reporting on the collapse of athletes all across the world in sports, on the field or during practices. And so to try and understand and get some context on all of the different possibilities that are taking place here, I want to say right now, I don't think anyone can say for certain what caused this incident exactly, but to try and investigate that thought and that question, I am joined now by the world-renowned cardiologist, most published heart doctor in the world, Peter McCullough. Dr. McCullough, I want to thank you for taking the time today to join us on this.
Thanks for having me.
Now, to begin with, the moment this happened, there seemed to be a real push. The next day, I started hearing a lot about the injury to this player as though this tackle caused it. But as you can see in that, montage that we just delivered, many professionals are saying they didn't feel like this looked like a hit that could cause this type of reaction. And one of the terms that came up was commotio cordis. And I looked this up just online, and it seems that there can be an injury to young athletes when a baseball or a lacrosse ball or even maybe a punch hits the lower sternum just right. But can you tell me just what do you know about commotio cordis to begin with, and can that cause a situation like this? I just want to understand that because there was a lot of press around that to begin with.
There's about 20 to 30 cases of commotio cordis per year, almost always in baseball or lacrosse, an unprotected breastbone. We've analyzed this on my Substack of, can it ever happen in football? And the answer is no, because the shoulder pads have a breastplate protector. So the players get hit with helmets in the chest all the time in routine tackles, and it diffuses the energy. So commotio cordis was quickly ruled out by all the people. I watched it live. I watched multiple reruns. Another thing is commotio cordis, as your figure points out, is spontaneous ventricular fibrillation. That didn't happen in his case. He made the tackle, he jumped up, he grabbed his face mask, then he fell over. That's not consistent with commotio cordis.
Right, and that's what I was saying when we were discussing it. I said almost like your heart has been shocked or something, or like electric shock. It stops the heart immediately. you wouldn't tackle someone, then stand up, clap your hands together. And we even timed it. It's about 9 seconds from the moment of that impact to the time he gets down, steps up, and then appears to lose consciousness. And so that was my question. And for people that are, because I think there's also, when these things happen, we get really concerned about our children in sports and those things. So when we think about that, it wouldn't look like this. Is that correct? That it would be a fairly instantaneous heart condition?
It would be instantaneous, although I've done my research here, and there's a paper in the European Society of Cardiology regarding myocarditis, not related to COVID or the vaccines, but prior myocarditis and the precipitation of cardiac arrest with blunt chest trauma. So it is possible in the setting of myocarditis that blunt chest trauma conceivably can do it. There are 2 published cases, but analyzing this, I can tell you as a cardiologist, I see patients, I field patients like this, I've managed out-of-hospital cardiac arrest, and I've published on it. This was a primary cardiac arrest in the setting of a surge of adrenaline on the field, implying that it is a primary electrical arrhythmia instability problem. He's on the mechanical ventilator. I'm sure they're putting therapeutic cooling. They're cooling the body right now. He's in a medical coma, which is intentional, let the brain recover. And then they'll start the process of assessing for neurologic recovery. You know, I looked at what was done on the field, Del. I think everything was done perfectly.
That's good.
That, in fact, once he was resuscitated, they waited in the paramedic unit in the tunnel for his mom to come out of the stands. He was that stable. They got his mom in the paramedic unit and went on to University of Cincinnati Medical Center. So these are all good signs. I predict, based on what I know, that he will recover. He'll come off the ventilator, and then it's a degree of his neurologic survival. I do think his playing days are over with. I anticipate he'll have an implantable cardiac defibrillator, and then he's going to need an evaluation for what was the cause of this.
And so, you know, when we think about that, and that would be really unfortunate if he's unable to play again, but as you're saying, this is a primary then cardiac arrest that was suffered here. So what would be the underlying natural causes of something like that? And is that something that is tested for in these athletes?
This is on the heels of a paper I've just published with Dr. Panagis Polycretis. And what we've reported on prior to COVID in the European soccer and rugby leagues, which is far more players than the NFL, prior to COVID, the number of cardiac arrests per year, about 29. And it's almost always congenital heart disease, including hypertrophic cardiomyopathy, previously not detected, or anomalous coronary artery disease. So it's a primary heart problem. And that's prior to COVID. The numbers now, since COVID-19 vaccination in 2021, have skyrocketed to 1,598 cardiac arrests on the field in Europe. So 2/3 of these are fatal. Fortunately, with Hamlin, we now know that, you know, at least it wasn't initially fatal. The AP has reported that 95% of NFL athletes are vaccinated, fully vaccinated, and 100% of staff. Now, the NFL dropped the vaccine mandates in March of 2022. But the NFL was a recipient of the White House HHS COVID Community Corps funding. Remember, $13 billion flowed in 2021 to organizations, and the NFL was one of the prominent organizations that took government money to mandate the vaccines on the players. So we have a very public situation. I can tell you, NFL athletes in the United States, they're screened for hypertrophic cardiomyopathy, they're screened for other conditions, they are determined, ready to go. So at the top of the differential diagnosis is if he took a COVID-19 vaccine, it would be COVID-19 subclinical myocarditis and a primary cardiac arrest. That would be at the top of the list. I think other things have been relatively ruled out now, including a spinal cord, head and neck, reflexive effect on the heart, commotio cordis. It would be unlikely he had a blood clot. It would be unlikely, by the way, that he had heart failure, because you can't run fast and be as strong as he is. I think the heart was actually good and strong. It just was in the milieu of having high levels of adrenaline that triggered this arrhythmia. And Brazilian physician Flavio Catagiani has in the peer-reviewed literature a proposed mechanism that in COVID-19 vaccine-induced myocarditis, that's the surge of catecholamines that triggers the cardiac arrest like we saw in Hamlin.
You know, and so when we look at this, and obviously everyone is talking about this conversation, there is a lot of, people that follow the work that we do on the High Wire, and, those that are questioning the safety of this vaccine are really being attacked for even suggesting that this is potentially being caused by the vaccine. Most of the posts I've seen have been fairly careful to say, as we all should, there's no way to know exactly without further investigation. We don't even know if he received the vaccine. But I find it interesting that they had no problem broadcasting on almost every news agency a very rare issue called commotio cordis, which they've ruled out. But we're not supposed to be suggesting, as you and I have discussed this over the last, more than a year, there are known side effects that deal with the heart by the CDC, by the FDA, that were seen in the trials, that are seen now even more so in studies out of Israel. We've discussed all of this. I saw a post recently where you and Malhotra have been making this point to say, until proven otherwise, as a heart specialist, should this be on the table, or is there some ethical reason we shouldn't be considering the vaccine as sort of all of the things that we believe, that we are hoping these doctors are investigating, that they're looking into, so that they can give the best diagnosis and prognosis for Damar Hamlin at this moment?
Well, there's a first simple step, is that the family, the Buffalo Bills doctors, the University of Cincinnati Medical Center doctors, and the NFL could just come out and say, did he take a COVID vaccine or not? His teammate Cole Beasley, he didn't take the vaccine. Aaron Rodgers didn't take the vaccine. Right. So that's a very simple step. To just allay any fears. One of the unique things about all the interviews and all the player tape that was generated from this is people looked sick and nauseated. Some people started to turn very pale. And I got a sense that people started to think, wait a minute, is this what the vaccine does to people? Right. This is right on the heels of the Rasmussen report. Yes. The Rasmussen report was done over the holidays, Del, and there are huge sample, 2/3 of people took the vaccine, a third didn't. The overall number of people who know somebody who's died of the vaccine now is 28%. Let me tell you, every commentator, every person, I was watching all the facial expressions. Sure, they were alarmed. Everyone's praying for Damar, his recovery, but people had a deeper sense of fear that they themselves, in fact, have this inside their body. And could this be what they have seen in the report by Polycretis and McCullough, the reports we've seen on a whole variety of documentaries? You mentioned the one I did with Malhotra, Until Proven Otherwise. Could this be it now, being right in front of them on prime TV, Monday Night Football?
And to be clear, what you mean by until proven otherwise is this, in many ways, is still an experimental product. We are only hitting 2 years out, so our understanding the long-term effects of it, we jumped out of the proper trials using emergency use authorization. Under those circumstances, we have a CDC and an FDA and regulatory agencies around the world that seem to be refusing to look at the extremely high death rates being reported to VAERS when it comes to this issue. Our nonprofit has fought and won the V-Safe data, which is showing us some very alarming details on the amount of reports and hospital visits from people. So under these circumstances, I think it was you that once said we need to use the French, court system, which is guilty until proven otherwise. This is a test product. Is that essentially the basis of science and the scientific method, that when we have a brand new product and we're seeing anomalies like we see the amount of people saying, I have never seen this before, we have to look at this and say, look, it's up to the CDC and the FDA to really prove to us that this is not what is causing these athletes to drop on fields all around the world, don't we? Is that where we're at now?
Well, that's a regulatory stance, and for sure that exists within 30 days of taking any product. It is assumed that the adverse event is due to the product, period. That's true of any drug. I chaired a day safety monitoring board one time, Dell, for a esophageal dysmotility drug. And I remember being told by the sponsor and the FDA, said, listen, 5. You have 5 unexplained cases where people pass out. This drug is gone. It's gone. And guess what? It happened. And the drug was gone. It never saw the light of day. So a strict regulatory stance is always to blame the new experimental product. We always do that. That is a safe and conservative thing to do. And what you saw in the media is no one would bring up the vaccine until I did on national TV the day afterwards. I was the first public figure to bring it up in the differential diagnosis. No one had the courage to bring it up, yet it was the elephant in the room. I guarantee it was on everyone's mind. You mentioned this idea of public awareness. It's not only the Rasmussen report. We have the Mark Skidmore MSU survey. 22% of people know somebody who's been significantly damaged with a COVID-19 vaccine. We have the Zogby survey, Children's Health Defense, 15% took the vaccine. They have some serious medical problem. And as you point out, the V-Safe data, 7 to 8% of people who take the vaccine are so sick they have to go to the hospital, the emergency room, 25% incapacitated. Listen, word of mouth, Del. This could be completely silent in the media. You know what the public is thinking? The public is thinking, you know what? This could be the vaccine.
Well, that is what we're seeing. I am glad that you are not afraid. It seems that there are real talking points being delivered across media stations throughout the world. I know it takes tremendous courage to say the things you're saying. I would assume that you are getting some pushback from medical professionals, as you have throughout your criticism of how this vaccine has been rolled out, how it was tested. But I think that this is, as a journalist, my job, since I don't believe the CDC and the FDA did a proper investigation of this product. I think it was rushed out. It is left now on the population, as we are all now guinea pigs, a part of this worldwide trial. Then who is going to point out? If we are all afraid to say these are known side effects, this should be looked into, and we are afraid to ask what the vaccine status is, as it's been pointed out, you are allowed to ask me my vaccine status to get into restaurants, as we saw through COVID. You can ask my vaccine status in order to get on an airplane and travel in a certain country, certainly to get back to the United States of America. You can ask my vaccine status to go and see a rock concert, but we are not supposed to be asking vaccine status when an athlete at the prime of their health and career collapsed with a heart attack in a very rare and odd moment. No one's supposed to ask that question. I want to say I'm glad you are asking that question. I believe it is medically sensible to ask that question. And I also want to lastly say that there has been some sort of shadow put upon T. Higgins, the wide receiver that ran into Damar Hamlin, as though somehow he caused this. I hope that everyone will recognize that, first of all, this was football. It's a tackle sport, and there's nothing that the runner, holding the ball should ever be responsible for. It's the defense that has to decide how they're going to take on that impact. But I think it's really bad in some ways that they ever even called this an injury, when really this seems to be, and we now know it truly was a heart condition. What it's caused by, what we're saying is what should certainly be on the table is his vaccine status.
Del, I agree. This is not a private health event. This is not. This is an athlete. He's part of the NFL. The NFL took government money overtly to mandate the vaccines. The NFL reported vaccination status for the players. Now a player has gone down. The FDA says the vaccines cause myocarditis. The peer-reviewed literature says there are autopsy-proven cases of fatal myocarditis with sudden death, just like this. So it is an ethical obligation for this patient's family. When he awakens, it'll be his responsibility, the team, Bill's team doctor responsibility, the NFL, and the University of Cincinnati Medical Center to all come out and disclose the vaccine status and answer the question, is this a vaccine-related sudden cardiac death or not? This is an ethical obligation that they have. And to every day that they remain silent on this, which is now about 2 days, is making America very edgy.
I agree with you. Dr. Peter McCullough, I want to thank you for your incredibly consistent voice in stating really the ethical and obvious decisions that doctors and scientists should be taking part in and discussing. So thank you for your time today. I really appreciate it. All right. Well, I hope that we will get a statement on the vaccine status of Damar Hamlin, because I agree with Dr. Peter McCullough. This is not just a personal issue. This is a worldwide issue, and we need proper reporting to be done. There should be no reporter afraid to ask questions about this. Certainly no doctor treating those of us that are ending up in hospitals with cardiac arrest. It should be the very first question being asked now, given, as what Dr. Peter McCullough just said, the FDA and the CDC have reported and know this is a known side effect of these vaccines. All right, well, we have a huge show today. I'm going to be asking Michael Yon, who is an ex-Green Beret, former Green Beret soldier that has sort of dedicated his life to investigating issues around the world, including what he is talking about as a coming famine, and a discussion we've had. But I can't wait to drill down with some questions of somebody that's actually been standing in the places that we see reported on in the news when it's Ukraine and China and all those things. So I'm really looking forward to that interview. But first, it's time for the Jackson Report. All right, Jeffrey, Happy New Year. How you doing?
What a year, Del. We're starting out and, just sitting listening. 2022 was really the year that Americans woke up en masse to questioning the safety of the COVID shot, as by that Rasmussen poll, 49%, if you want to put a figure on that. And that's a big number. And then also, this is probably the year that they also started to question really the FDA, which was responsible for the approval of that shot in the arms of every man, woman, child, and infant in the United States.
Yeah.
But, this conversation has cast such a huge shadow over the last couple of years. And there's a lot of other drugs and medications and behavior that the FDA has engaged in that's really gone under the carpet. And one of the drugs we want to talk about now, we're in a position of kind of this watchdog as this health journalism. That's what we do. And so we want to look at this drug called Repatha. This is a cholesterol lowering drug. And, this is one of the commercials. If anybody's not familiar with this, maybe you've seen this commercial on TV lately. Check it out.
Okay.
You eat healthy, take statins, but still struggle to lower your LDL bad cholesterol. You also have heart disease and fear a heart attack or stroke could strike without warning, pulling you away from everything you love. Because with high LDL, your risk of a heart attack or stroke is real. Now you can reduce that risk with Repatha. Repatha plus a statin dramatically lowers your LDL bad cholesterol by 63% and is proven to significantly drop your risk of having a devastating heart attack or stroke.
Do not take Repatha if you're allergic to it. Repatha may cause serious allergic reactions. Signs include redness, severe rash or itching, swollen face, or trouble breathing. Most common side effects include runny nose, sore throat, common cold symptoms, flu or flu-like symptoms, back pain, high blood sugar, and redness, pain, or bruising at the injection site.
Don't let a heart attack or stroke come between you and everything you love. Tell your doctor you're ready to lower your LDL and reduce your risk for real with Repatha.
Pay no more than $5 per month with the Repatha copay card.
Well, that's some pretty happy and jovial music of some people just surviving life beautifully. Can I go ahead and assume that this story is not so happy and joyful and bubbly?
I wish I could tell you it was happy. But it does have a happy ending because truth is actually coming out here. Good. So the BMJ put forward an initiative called the Restoring Invisible and Abandoned Trials, RIAT. And this was basically an initiative by independent researchers where they gather the data from these trials that the drug companies do, send to the FDA and say, hey, guess what? Everything looks cool. The FDA greenlights these drugs. But independent researchers can now grab this data if they can get a hold of it and recreate these studies and to see what they find, obviously without, some of the conflicts of interest involved. So that's just what happened with this drug. So this is a cholesterol lowering drug. It's been out in the market for about 7 years now. And here's the headline. Here is this restored trial. Headline, restoring mortality data in the 4-year cardiovascular outcomes trial of evolocumab in patients with cardiovascular disease, a reanalysis based on regulatory data. And listen to what they found, Del. When comparing the CSRS, the case study reports, information with the 2017 primary results publication, that's the publication that the drug company did, we found 11 more deaths from myocardial infarction in the evolocumab group, 36 versus 25, and 3 less deaths in the placebo group, 27 versus 30, respectively. In the clinical study report, CSR, the number of deaths due to cardiac failure in the evolocumab group was almost double those in the placebo group, 31 versus 16. Let's just take a breath on that for a second. Yeah. Almost double cardiac failures. And
wow.
So this brings us to, what did they report
isn't that exactly what the drug's supposed to stop from happening?
Yes.
I mean, it's just a slight failure there. It's going to increase the risk of the very thing that you're buying it for.
Right. This is why this is such an important story. So in 2017, the drug company came out, it was actually published in the New England Journal of Medicine, with these amazing results, evolocumab, and clinical outcomes in patients with cardiovascular disease. And let's look at their conclusion. Now, remember, this was already redone, but in 2017, this is what people were greeted to. In our trial, inhibition of PCSK9 with evolocumab on a background of statin therapy lowered LDL cholesterol levels and reduced the risk of cardiovascular events. You know, kind of like heart failure and myocardial infarction.
Yeah.
So here's the crazy part, though. So this was approved by the FDA, this drug, in 2015. Here's the actual headline here. In 2015, FDA approves Repatha, a second drug for cholesterol and a potent new class. They didn't even have the clinical data yet. So it says here in this article, until 2017, when the clinical trial results are expected to be in, doctors and patients will have to choose the outcome that makes them most comfortable, the lowest possible LDL level or the lowest dose that gets their LDL to what appears to be safe. It goes on to say, for now, it's anybody's guess which treatment strategy is the optimal one. You might as well flip a coin, Dr. Krumholtz said. He's a Yale cardiologist. So this is kind of what the behavior of the FDA, kind of just throwing this thing out, trusting the drug companies. Obviously, we've reported on this a lot, but it's still going on, and we're leading this up to a point here. But this isn't the only behavior that the FDA has been doing outside of the COVID shot. In 2021, we had 3 of their independent advisors resign over an Alzheimer's drug that was approved. 3 FDA advisors resigned over agency's approval of Alzheimer's drug. This is the drug Aduhelm. $56,000 a year this drug costs. All 11 of the advisors did not vote to go ahead with this because the clinical data did not show that it was really helpful, and there was uncertain risks on this. The FDA approved it anyway.
Wow.
And what was interesting about this, though, is that kicked off an investigation, a congressional oversight investigation, which, as you and I know, is kind of rare looking into the FDA when it's going just cavalier approving these drugs. So it was an 18-month investigation. And here's the headline here. This just brings us to present day. FDA faulted for working improperly with Biogen before clearing Alzheimer's drug. This was an 18-month investigation. And what's interesting about this, it was the Democrat-led House Oversight and Reform Committee. Now, as we know in our reporting here, the Democratic Party is typically the weakest host when it comes to the pharmaceutical company. In 2019, we saw Democratic governors across the United States put forward over 100+ bills during the measles outbreak to basically get these shots into people and mandate them, absent religious freedom. So this is actually a good sign here. We're having a Democrat-led House oversight on this. And they found that the FDA...
that it's gotten that bad. It's gotten so bad that one of the big funding bodies of the party, and I say this, I always want to say we're not a political show. I consider myself politically marooned, raised a Democrat my whole life. And I used to always say, well, Democrats don't take industrial money. That's the Republican side. But now it is clear pharma is funding Democrats. So it is good to see the investigation. And what I want to point out is so important here, Jeffrey, is the work that we do. I get this question a lot. In fact, I had a lot over the holidays, which is, who is the bad guy in all this? As people are waking up to this COVID vaccine really being a problem, who are we supposed to blame? I said, well, look, our government took on the liability. They took all the liability away from the industry. But let me be clear about our position at ICANN, really, and that's this. My belief is that industries lie. They always do. If BP spills oil, they're going to hide it. That's That's their nature. If Exxon does something wrong, they're going to hide it. They're going to lie about it. If anyone can put out a product without doing proper safety testing and get away with it, they will. I mean, that is just the nature of industry. It's the regulatory agencies that are supposed to protect us from those dangerous practices. When we lose our regulatory agencies or they start colluding with the industries we're supposed to be protected from, that's when we're in serious trouble. That's why the focus of ICANN's lawsuits has, for the most part, been against the FDA, NIH, CDC, Health and Human Services. We've won lawsuits against every one of these agencies. There it is, the list, and it keeps on growing. The problem is the regulatory agencies. You'll never be able to change greed. You'll never be able to change people that go after the bottom line and try to shuffle their problems under the rug. I think, unfortunately, the hand in the cookie jar and the lie about it is human nature. But that's what regulatory agencies are supposed to protect us from. It's why this story is so scary.
Right, and that's exactly what this investigation, this 18-month investigation found, is the FDA inappropriately collaborated with Biogen. They found that 66 of their meetings were not documented accurately, so, kind of off-the-record meetings. They had a lot of meetings running up to this approval for this drug. And so that brings us to this. So we're painting a picture of an ecosystem, as you just perfectly described, this ecosystem of these revolving doors, these problems, and, on the back of an Operation Warp Speed that has now given the medical community an idea of saying, wait a minute, we don't have to wait this long. We don't have to spend this much money to get these drugs approved. We can do this faster because we did it with the COVID vaccine and it seems to be working.
That works so well.
Yeah. And so now we have this. This is the headline here. The FDA Modernization Act. By eliminating requirement for animal testing, FDA Modernization Act allows faster, more cost-effective drug treatment. So what they're doing, this is not an outright ban, but they're not having a requirement on animal testing. This is so drug developers, they can use alternative methods for safety testing on drugs and vaccines. So this, this is a double-edged sword for the PETA people. This is obviously a win, but for us who have been documenting this for a long time and the behavior of pharmaceutical companies, this is a big red flag. So let's look. So animal studies potentially are out. So now let's look what they're going to replace this with. So in this article, it goes on to say this. These include cell-based assays, organ chips, and microphysiological systems, and sophisticated, for computer modeling. Several of these approaches allow drug developers to incorporate safety assessments, alternatives that are robust enough to convince regulators that a program has been adequately de-risked. That's one of the first times I've heard of this now, de-risked.
De-risked.
So has your drug been de-risked? Well, Repatha was not de-risked, apparently. So now it goes on to say this, and get ready for this. So we know in vivo is basically testing the drugs in the bodies of people. In vitro is a petri dish.
Yes.
Get ready for a new term here. So it goes on in this article. It says sophisticated modeling. Oh, it's sophisticated. It must be nice. That uses in silico computer-based testing with virtual patients.
What?
Biosimulation is fast and relatively inexpensive and reveals rich information about how a drug would perform and how to best design a trial before the drug is ever tested in patients. So we're testing them in virtual patients now.
I love it.
Safety.
So instead of why bother with animals? Like, let's just go straight to cartoons. We did this test on a cartoon, and Bart Simpson turned out just fine.
Yeah.
I mean, there's literally you can't even believe these terms. The in silico study told us it was safe.
Like, we tested the entire cast of the Family Guy. It's safe. Trust us. So this is obviously a gigantic problem because we're giving drug developers an out so they don't have to spend more money, and we always know how that works. And we're giving them an out to get the product to market faster with modeling and virtual testing. So some big red flags there. This has been signed into law by Biden, and it was passed by Congress just a couple weeks ago.
Which, by the way, I think just as I sit here and think about this, is the importance of what our focus is end all mandates. While you jerks are making decisions like this, you're already so corrupted, you're not doing your job correctly. Now you want to even relax whatever restrictions or testing needed to be done. So, okay, go ahead. For any fool that wants to go ahead and trust whoever, Bart Simpson got tested with a product, I'm going to take it now. That's okay. It's a free country. You're allowed to live that way. But you don't don't get to mandate that on me. End of all mandates. Go ahead, take away all restrictions. I don't care if you ever safety test anything. That's fine, but you can never make me take it. I'm going to read your trials. I'm going to do the information. I'm going to look at it myself. I'm going to see what you did and did not test, and then I'm going to make the decision for my own body. It's shocking that we actually even have a debate over this any longer in this country. Anyone, if you have a brain out there, if you have loved ones that have blood cells still moving through their brain, please wake them up. It is time to end all mandates because we are no longer being protected by dangerous products.
And let's talk mandates, COVID specifically. Are they off? Are they on? Well, in China, they're apparently off. Here's the headline. Xi Jinping has abandoned zero COVID. What happens now? So zero COVID after almost, I think it's 3 years now. That is the policy, the last country to really go down there with zero COVID. They've had it going essentially since the Wuhan outbreak happened. And so all the protests that we've been covering there, they seem to have made a difference because people were out in the streets on the run up to Christmas. And now zero COVID is over in China. So what happens now? Do we all go back to a happy life? Well, here's some of the headlines here because a lot of people are worrying about variants. Economic Times, COVID-19, no new variants seen in China, sequencing efforts strengthen. But although we're being assured that no new variants are happening, we're getting headlines like this. And it's talking about other countries that are really getting some cold feet on not having restrictions. China is now the perfect breeding ground for new COVID variants, and Britain must act. So we're having the European Union member states talking about bringing back some restrictions. Even the United States is doing air travel restrictions from people with China. They're testing them before they get here. So one of the big things, the big story here is the fear that's being built around the dropping of the zero COVID in China. And that looks like this. You're seeing it in headlines everywhere. Business Insider, China is likely seeing over 1 million COVID cases and 5,000 deaths a day, report says. But Beijing's official data is showing 7 deaths so far this week. It goes in there to say on the article, more than 5,000 people are likely dying from COVID-19 in China each day, in stark contrast to Beijing's official count of just 7 deaths in the past week, according to Airfinity, a health data company. First time we're hearing this. Airfinity, remember that. Airfinity's data modeling, here we go, shows China is likely seeing over 1 million COVID cases a day in what is called a stark contrast to official figures per a press release on Wednesday. Next headline, we're going chronologically with these. Now we're talking 9,000. Reuters, China COVID-19 deaths accelerate to 9,000 a day. UK research firm Airfinity, there we go again.
Wow,
and now
weird.
the latest headline, Newsweek, China sees 14,700 COVID deaths every day, models suggest. And what are those models from? Airfinity. What the heck is Airfinity? That's what I want to know, because this looks a lot like the Imperial College and Neil Ferguson when that run-up was happening over 2 years ago. So what's interesting is a lot of countries are starting to, in this little gray area that's happening, incorporate this Airfinity modeling into the conversation of should we bring back restrictions? And so
right,
we did a little
and by the way, overriding, I mean, not that I trust China or whatever, but it's just really weird. We get this sense because we see it in so many different newspapers that different news agencies and different, investigators are coming to similar conclusions. But no, all it takes is one little group like an Airfinity or a Royal, the Imperial College to put it out, and then they all pick it up, and we get this sense, oh, it's everywhere. But you could change the world these days with like 5 people around a computer in somebody's mother's, basement. I mean, as long as that's all that we report on.
Right. And that was one of the issues coming out of China, Wuhan in China was, well, China's not giving us the greatest data collection. So let's jump over to the Imperial College and see what they have to do. Because these are doctors, these are scientists. This is a reputable college. So are there doctors? Are there scientists and colleges behind Airfinity? Well, let's look at their inception. I did a little research on this. This is what I found. This says Airfinity is a powerful, this is from their inception in 2015, is a powerful data-driven event intelligence platform seeking to unlock the hidden value in the data of the $1 trillion event industry. Leveraging its proprietary event graph technology, the Airfinity platform enables event organizers to gain deep audience insights while also enabling the companies to find and assess the right events to attend, speak at, and sponsor.
Oh, so I see what happened here. COVID hit. Suddenly no one is speaking live. The entire purpose of this company, we got to hand it to them, right? All right, back to the drawing boards, folks. Nobody is speaking anywhere. So what do? I don't know. Let's get into science.
Exactly. And so let's check
Wow.
out some of their recent, over the last 2 months, they really never really talked about China. And in the last 2 months, let's look at some of their press releases. And this is what's driving these headlines. November 27th, China risks between 1.3 and 2.1 million deaths if it ends its COVID zero strategy. This is at Airfinity's press release. December 20th, China's COVID-19 wave forecast to have 2 peaks where cases could reach 4.2 million a day. And so you have press releases. They're being immediately incorporated into the media. Bloomberg, some of the people at Airfinity are actually getting airtime at these news agencies. But again, just to remind people, in 2020, March of 2020, this is what the headlines looked then. It looks a lot like now. This is the Imperial College study predicts COVID-19 will kill 510,000 people in Britain, 2.2 million in the US. Remember, Fauci and Birx picked that up, and those were the seeds of the lockdown restrictions in the United States. And then how did those turn out? Well, we know, but let's look at it through the headlines. Models failed. Imperial College predicted catastrophe in every country on Earth. Then the models failed. And then this one really tells the story. Neil Ferguson's Imperial model could be the most devastating software mistake of all time. Del, we're going to be keeping an eye on this company, Airfinity's movements. It's kind of concerning that this fear is being pushed in these headlines. This is something that is front and center on our plate right now, because obviously, if these restrictions come back, it's not going to be science driven. It's going to be hype and computer modeling again.
And look, this may all just be using this argument to somehow try and get a leg up against China. Let's lock them down. Let's not let them travel so that the rest of the nations can somehow find a footing. These may be war tactics. And it's all part of what I'm really looking forward to talking about with Michael Yon about. But, you know, when we look at these situations, it is being driven for a reason, right? They're telling these stories for a reason. And we've got to start sort of peeling back and looking at where's the reality of this? What does a computer model have to, what's going into these computer models? Where's it coming from? What data are you using?
And it's already been agreed upon that trying to model the behavior of COVID and the COVID outbreaks is at this point a failure. Even Johnny Unitas says that through his studies, it's a failure when it comes to computer modeling. So at this point, to trust those after what happened is really seems to be a fool's errand. But let's go to data we do know. So we've been tracking the Twitter files dump. This is after Elon Musk came in. He promised transparency. He's been selectively giving certain journalists data dumps, curated data dumps of information. And we know now a lot of it has been around the political aspect of it. So the censoring of Donald Trump, Hunter Biden's laptop. We know through Matt Taibbi, he's one of the first journalists that actually was reporting on these, that he says every conceivable wing of the enforcement agencies of the U.S. government were in some way sending moderation requests to Twitter. A lot of them were being okayed and greenlit. But now we have journalist David Zweig. So what he did was he actually released the first batch of the COVID files. So we knew the censorship was happening. We saw even Peter McCullough was kicked off, Robert Malone. So many people were shadow banned, deboosted. So he started to look into these files here, this data dump. And this is what he had to say on Twitter. Very interesting points. He says there are 3 serious problems with the Twitter process. He says, first, much of the content moderation was conducted by bots trained on machine learning and AI. Impressive in their engineering, yet too crude for such a nuanced work. So he also goes on to say this. Secondly, contractors, you're going to love this, Del, in places like the Philippines also moderated content. They were given decision trees to aid in the process, but tasking non-experts to adjudicate tweets on complex topics like myocarditis and mask efficacy, data was destined for a significant error rate. You don't say. So we have someone in the Philippines basically looking at Peter McCullough's information on myocarditis and saying, well, let's run that through the data tree. Out you go. And then he said, the third problem, as we see with a lot of these hierarchical structures, third, most importantly, the buck stopped with the higher level employees at Twitter who chose the inputs for the bots and decision trees and subjectively decided escalated cases and suspensions. As it is with all people and institutions, there was an individual and collective bias. But, we've already kind of known this at Twitter. This is obviously helping the conversation. We're getting this information. We're having more people look at this. The Twitter files are getting the world's eyes on this problem, where before it was maybe just a small, nuanced portion of the population that really knew this. But America's First League, they had a legal litigation against the CDC. and they came out in early December before the Twitter files, just weeks before the Twitter files dumped, and they actually gave us source documents. They had emails from the CDC to Twitter about moderation and censorship. So this is one of the emails here. We'll look at actually a couple of them. And this is Carol Crawford. She's the digital media branch chief, and she writes to Todd O'Boyle at Twitter. He's one of the higher ups there. And Todd says, "Hi, Carol, thanks for sharing." So Carol sent over a list of people she wanted looked at to maybe for censorship, for COVID misinformation, as the subject says in the email. And he says, "Carol, thanks for sharing this. Agree, these are important trends to note. A quick scan shows that at least some of these have been previously reviewed in action. I will now ask the team to review the others. Carol, remind me," he says, "did you have a chance to enroll in our partner support portal? In the future, that's the best way to get a spreadsheet like this reviewed." So she's sending spreadsheets of people over there to get reviewed and possibly censored, but they have a partner support portal just like Facebook did. It's an express portal for government employees of any agency to put in their email address, and they get back-end access to these big tech platforms for moderation purposes. So they get kind of front and center, the VIP seating, if you will, to the censorship seat. So
Wow.
let's look at what they say next. This is what Carol says. So the Twitter guy says, "Hey, you want to get into our express lane?" And she says this, does it need to be the CDC account or my personal? If CDC, I'm going to have someone on staff enroll me instead. So she's basically saying, I don't really want to use my CDC account. Can I have a personal account to use this? Because I don't really want it on record in case this comes out in Discovery like it is right now.
On the high wires somewhere out in the future.
you gotta think the CDC people are saying, I don't want my emails read on the high wire. And hold on, you're not going to be disappointed. So that actually did work, and so they used her personal email according to this email here. So. But remember this, this could be a trivia question. What person did the CDC celebrate most when they were deplatformed? And that, Del, was you. And this is something we've covered. This is emails that were discovered through the Informed Consent Action Network FOIA requests to the CDC. And this is what happened when we were removed from YouTube. We have emails here showing in August 2020, that was really obviously early on. Subject to the email, Deb Bigtree removed from YouTube. And this obviously was early on in the pandemic. We were nailing the facts and we got kicked out of the game on YouTube, on Facebook. No more streaming there. And let's go through here. We have Melinda Wharton, she's at the CDC. She just gives an exclamation mark. Oh my gosh. And then we have Kristen Nordlund. She says, FYI. Remember, we have Nancy Messonnier on here. She's the CDC director. And then we have Carol Hayes. She just says, oh my gosh, this is actually happening. So this is being passed around all the way to the director is copied on these. So this is obviously a very important subject for people within the CDC, that you and the Highwire were deplatformed. So throughout the entire big tech apparatus, through the Twitter files, through the FOIAs of agencies like or nonprofits like ICANN or AFL, we're getting this picture, this monolithic, these big tech platforms are almost subsidiaries of the U.S. government doing their bidding. And this is the truth of how it's happening right now in the United States.
Our founding fathers would be so proud of what's happened to freedom of speech, freedom of the press, freedom of religion. So much work to do to bring back the light of this nation as a beacon for the world. Jeffrey, great reporting. Thank you so much for all that you're doing. I really look forward to working with you this year.
Thank you so much.
All right, take care. You know, I want you, can you imagine? I mean, like, you sit at home sometimes and go, God, it'd be really weird to see emails with like my own name in it and people talking about it and like exclamation points, you know, celebrating the fact that I was kicked off of some platform. I have to tell you, it's weird. You never get used to it. I mean, when I read it right there, you're not designed to be sitting in the seat and reading that. It's really bizarre. But deep down, when we're doing the work we're doing, and, you know, nothing tells you you're making, you know, a difference than seeing them talk about the work that we're doing, getting excited when they think they've stopped us from doing what we're doing. But guess what? We haven't stopped. All we've done is grow. All you've done is help us grow this audience and expand it out across the world. We're now an international show. We went from, I think the moment we were kicked off of YouTube, we were lucky if we had one of our episodes potentially get 1 million views. That would be like cause for celebration, usually hundreds of thousands. Now 5 to 7 million of you are visiting our website every single week and growing. I want to just thank all of you new viewers that are brand new to us. And that brings me to this point. there is a huge conversation going on right now. Right before the holidays, they talked about the fact that there's a lot of newcomers to this so-called anti-vaccine movement or vaccine hesitancy movement that, really believed in medicine, really believed in vaccines, but this COVID vaccine was so egregious, so poorly tested that they had to jump ship. I actually think the huge difference was this wasn't going to be given to babies, it was going to be given to them. When Donald Trump said, the first people I want to get this totally experimental product, never been in a human being, basically almost killed every animal in an animal trial for the last 20 years, it's going to be the doctors, the frontline doctors, you get it first. Suddenly there was a bunch of them that said, whoa, 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 why me? I mean, why me? And so I think that has changed the culture here. But now there's a real, desire to compartmentalize the COVID vaccine issue and then really just say it's only COVID vaccine, not the childhood vaccine program. Don't make a mistake. That was brilliantly tested. That is so well done. We know those are completely safe. This is an anomaly. In fact, there's been tweets out by guys like Martin Kulldorff, who I totally respect, that, are part of the Great Barrington Declaration. But now, they're on shaky ground. They know this COVID vaccine is a disaster, but they also want to uphold the science as they know it. And so they're tweeting out things like, it's fine to be against the COVID. Here it is. The MMR vaccine is very effective at preventing measles. It does not cause autism. In 2019, after plummeting vaccine rates, the Samoa measles outbreak killed 83 of 5,697 infected. He's making these statements because he's trying to say COVID vaccine bad, childhood vaccine good. It's okay, Martin, I get it. You have never really done any investigation into this. This is a part of the orthodoxy you've been a part of. It's really hard to let go of it, but this is the work that we do. I'm about to show you we just released a press release. And by the way, if you were just simply a member of our newsletter, which all you have to do right now is just go down on the page at the High Wire and just type in your email. And now you'll be sent every time there's a breaking news story, a legal story, or if you just want all of the facts that we've delivered on our show today, on Monday, you get every piece of evidence we have, every study that McCullough talks about, the entire study is in your hands. You get to have the evidence in your hands. We're calling it the High Wire Protocol, total transparency in journalism. We want everyone else to do it. But if you aren't a part of our newsletter, then you're not a part of that process. You are not helping us advance how news should be happening. Now, what you will find out is today we took the Catherine Edwards, let me hold on here. I got a giant book to explain this to you. This is the Bible on vaccines, Plotkin on vaccine, Plotkin's vaccines. Now, we have a total deposition, complete deposition of Stanley Plotkin, the godfather of vaccines. But look at the other names up there, and you will find that Catherine Edwards is a part of this. In fact, she's the godmother of the vaccine program. There's barely a vaccine on the schedule for children that she wasn't a part of the clinical trials. I've told you before, when you're donating to the High Wire, part of what you're doing is helping, nearly half of the proceeds that come in go to our legal work, to sue the CDC, FDA, to get involved in personal cases. We stopped the Washington, D.C. minor consent for vaccine bill where they were trying to allow children to vaccinate themselves without parental approval. We broke that law and shut it down. Fighting for the military. We had a huge show about that. Just go back and watch the show right before the holidays. But what I want to say is this. One of the things we do is Aaron Siri is by far, I think, the most talented lawyer when it comes to doing depositions and doing cross-examinations of science and specifically vaccine specialists. So there was a case about autism and a child that got autism, as they believed, right after vaccination. And Catherine Edwards was brought in as the specialist to say that that's not true. Now, if you're brand new, this is why I'm sharing with you, you're probably asking, well, there's the COVID vaccine. What about the childhood vaccines? They've been tested, correctly, right? Well, this is what they tell us. The studies have been done. We know, just as Martin Kulldorff so confidently said, vaccines don't cause autism. The science has been done. Well, while she was on the stand, Aaron Siri got into that exact question in this case that happened in Tennessee. You are going to have, by the way, we just posted on our website hours and hours of both the cross-examination, which you're about to watch, the deposition, which happened over Zoom, and then the cross-examination, which happened in a courtroom. Here's what I do. Just go to the High Wire. You just go down and click on, I guess they call it the hamburger there, the I Can Legal. Click on that. Boom, that button takes you to to. You got the Stanley Plotkin depositions there, but now we also have the Catherine Edwards cross-examinations. But thehighwire.com/ICANLegal will also get you there very easily. Okay, this is just a couple minutes because this is so revealing, and this this is important to everybody that has a child. Everyone that's ever been a part of this vaccine program, get ready for what I think is, again, one of the most important depositions ever done. Listen to this.
If you're going to design a clinical trial of a vaccine giving to children 18 months or younger, how long would that clinical trial need to be to determine whether the vaccine caused autism?
In general, the autism is generally diagnosed somewhere within the first couple years of life. And I think maybe the mean time is about 2 years, depending upon the severity. So I think however, I think that most of the going theories would suggest that autism is really a prenatal event and not an event that happens after the child is born. So I think that what you're asking me is a little bit of a loaded question, so I will ask you, or I will answer in that that the vaccine trials that are conducted always have a tail of about a year that is required for the manufacturers to follow the patients.
For the vaccines licensed, by the year 2000, how many children would you estimate need to be in those clinical trials to detect whether the vaccine caused autism by 8 to 18 months, and how long would the trial need to continue after 18 months of age?
I can't give you those numbers off the top of my head, exactly how they would be. I think that I think one of the, when you have a rare event, although, autism is now felt to be about 1.5% of the population, when you have a rare event, and particularly when it might have been more difficult to diagnose earlier, in an earlier time, then I think it takes larger numbers, but I can't give you that number, Sarah.
Now remember, she is involved in designing the trials and being a part of the trials for the vaccine program as we know it. She is literally at the top of the field. But let me explain to you, for those of you that we do get in the weeds on this show, we are not going to just try and zip through this. I want you to understand what's happening here. Here is the question. Autism is said to be very rare. She says it's about 1.5% of the population, so 1.5 people out of 100. Remember, back in the 1960s, 70s, autism was said to be 1 in 10,000. We are now inside of 1 in 100, okay, as far as she's admitting to, but the data, that's not even actually accurate. If you look at the national data, we have some of it here. They say the U.S. autism rate is 1 in 44. However, the New Jersey rate, where they do better record keeping, is 1 in 35 among 8-year-old children. And so by 8 years old is usually when you've collected all those that would have autism. They're at 1 in 35. And look at this. Boys with ASD outnumber girls 4.2 to 1. You can only imagine the math. In my head, I can't. But if we're at 1 in 33 and it's 4 times more prevalent in boys, you're talking 1 in 18 boys, 1 in 20 boys, somewhere in there, for you mathematicians out there, is being diagnosed with autism in the United States of America, up from 1 in 10,000. So now the question is, when you, Catherine Edwards, are here on the stand or are planning to be on the stand and say that vaccines don't cause autism, what was the size of the trial that you did to determine that? And how long was it? These are the two questions he's bringing her. Because if, let's say 1 in 33, let's say roughly 3 out of 100 would get autism in a vaccine trial, how many would we need in the placebo group and in the vaccine vaccine group in order to determine with statistical significance that it is being caused by the vaccine. Now, she says, I don't know the number, and I don't either. I'm not a specialist. I would say thousands. In fact, I would say if you did a study like Moderna had with 30,000 people for the coronavirus vaccine, or Pfizer had 46,000 people, half of which got the placebo and the other half got the vaccine, that would about do it. That would about do it. And if the timeline, and by the way, how many were in the most recent MMR that we give our kids, the measles, mumps, rubella vaccine? Less than 1,000. Not 30,000 like Moderna, not, 46,000. So Martin Koldorf, when you're like, I hate the COVID vaccine trials, but I love the childhood vaccine. Really? Really? Because I would have dreamed that the MMR got that many people in a trial. But here's the issue. So you don't have enough kids in the trial to determine whether there's a statistical problem or not. And now what about the duration? How long did you track them? Because if autism only appears after vaccination, as she said, usually in about 2 years, but honestly, we don't fully get the full group till about 8 years old. You would have to imagine this trial would have to be at least 4 years long if you're going to rule out the potential for a vaccine to cause autism. Well, with MMR, how long was the trial? Guess what? It wasn't 4 years. It wasn't 4 months. It was 42 days with less than 1,000 kids. This is the problem, Martin Koldorf. This is the problem with this ideology. The trials haven't been done. The question is Aaron Siri talented enough to get this person that knows exactly what he's trying to get out of her to admit you never did the proper trials to be able to make that statement? Can he do it? Just watch.
Given what you know about clinical trials, would you agree with me that the clinical trials relied upon to license the vaccines given for Yates were not designed to determine whether these products cause autism when given to an infant or toddler at or below the age of 18 months?
I think those trials were likely not powered to answer that question. I don't recall the actual number that were enrolled in the MMR vaccine trials, and so I can't say that definitively. But I would trust that it likely was not large enough, and that's why large database studies are needed to really assess that in a phase 4 assessment.
So it sounds like you would agree there weren't. They probably, as you said, are unlikely to be improperly powered, and they would have needed to review safety long enough as well to determine, to capture enough children in the experimental and control group that had or didn't have autism in order to make an assessment of whether the product caused autism, correct?
Yes, sir. If an adverse event were to occur associated with vaccines, that if it were an uncommon event and if it was not diagnosed until later, then you would need a larger number of sample size and a longer period to assess that. I am not saying, however, by answering yes to your questions that I believe that vaccines cause autism. So I just want to make sure that you understand what I'm saying.
Never asked that question. Absolutely. I think the record's clear on that. How long would safety have to be tracked in the clinical trials relied upon to license the vaccines Yates received in order for them to have determined whether the vaccine caused autism?
Object to form the question. You may answer, doctor, if you have the answer.
I'm not going to answer it. I've already answered the question.
I don't recall that you have not provided any period of time. Are you saying you don't know the period of time? Please.
I said that the studies that were involved in the licensure of MMR did not provide an adequate number of patients that had been followed for 4 years to determine a rare event that would happen 4 years after vaccination. That's what I'm saying.
According to your profile, you have done most of the pivotal trials relied upon to license many of the vaccines, correct, on the market?
Yes, sir.
Okay. So you're highly experienced at conducting clinical trials, correct?
I'm highly experienced conducting clinical trials.
Okay. And you're familiar with many of the clinical trials that relied upon to license many of the vaccines currently on the market, correct?
I am.
Okay. In your opinion, Did the clinical trials relied upon to license the vaccines that Yates received, many of which are still on the market today? Were they designed to rule out that the vaccine causes autism?
No. You've badgered me into answering the question the way you want me to, but I think that that's probably the answer.
Is that your accurate and truthful testimony?
Yes.
Thank you.
I don't know. I hope you don't have to be a geek to really get into that. I mean, that is absolutely stunning. And by the way, the footage we put up is the raw footage. It is unedited. We cut that down. That's about, I don't know, 20 minutes, 30 minutes of Erin having to work her into that position where she finally just gives up the ghost and tells the truth. And so we're going to continue to edit pieces of that. But it's all a part of what ICANN does. We send Erin in. We sent them for weeks to be a part of this case and funded that to happen so that we can now have this as evidence for newspapers and news agencies. And we hope that other groups write about this incredible deposition because that's how change is made. And we hope that Rand Paul gets a chance to see it. And by the way, take these clips as we make them and send them to your representatives and say, this is why I want you to end mandates. Vaccine mandates cannot happen under this wishful thinking type of science that's going on. It does not work. And by the way, I want liability back on the manufacturers. If the FDA and this head, is going to be a part of our regulatory agencies, then no liability protection. Let's see how many MMR vaccines we're all forced to take when all liability for injury, when we finally maybe do a study like she said should be done in the databases of the world, which, by the way, the CDC has refused to do the comparative vaccinated versus unvaccinated study we've been asking for a long time. She said that'd be the only way you would know. And here it is, folks. Not a single one of the childhood vaccines that are in your children's schedule, they're all right there. None of them was ever tested against the saline placebo. So Moderna's COVID vaccine, saline placebo, because we've threatened to sue, they actually changed that. Same thing with Pfizer, but not in your childhood vaccines. No saline placebo, no long-term study that went beyond 6 months. And by the way, ultimately never enough kids in order to see the issues that we're seeing skyrocket all through our population. So we're going to continue to bring you more and more information throughout the year because so many of you are brand new to this. Many of us need to revisit this because now that we watch COVID happen right before our eyes, a lot of this is going to make a lot more sense to you. This is how it's always been done. It's a shell game. They're liars. They're cheaters. And our lives are being put at risk. For us to win this, everyone needs to understand this. We need to be able to keep sending Erin Seary to every legal case that's happening so that we can provide this evidence for free to every news agency that dares to report on it. You are making that possible. I can't tell you how important you are this year. We have won some battles. We are turning this battleship around. We are moving it in the opposite direction. But we do not win this if we do not bring everything we have now. As I've said it before, Goliath is dizzy. Man, we got a chin shot in there, but if we don't keep striking now, it's over. They're coming back. So do you want to win? Do you really want to make a difference? Then stop just watching the television and watching what we're doing and being shocked and giggling to yourself when Catherine Edwards goes and actually make a difference. Become a recurring donor. It'd be really awesome. Just go to thehighwire.com, click on donate in the upper right-hand corner. You're the one that makes this possible. Donate now. We're asking you to become a recurring donor. That's what really helps us know what to do. And there it is. $23. How about $23 a month for 2023? Once a month. Come on. That is practically a large Frappuccino these days. You can make a difference. Certainly one pizza and you get to change the world. Or you can just text us. Text us at 72022. Write in the word donate. And you'll have a link sent to you where you get the moment you check on that link. You click on it and throw anything our way. Whatever you can afford once a month. You get to start actually making a difference in this world and then tuning in every week to see how we do it. speaking of the world, speaking of trying to understand the world, I'm going to stretch my wings out here. We come from, I come from the Doctor's Television Show, medical television, the Dr. Phil Show. My executive producer also came over with me to do this work. But there are so many questions. And now that I understand how the vaccine lies are being told, how they're being built, and I get to go to these great speaking events everywhere where I meet cryptocurrency people and banking people and oil and gas and war people, and they start laying out how the fraud is taking place on the population, and I start thinking, oh my God, it's the same exact playbook. Well, there's somebody that has been doing this long before I have, that is actually putting his boots into the spaces that are all the questions we have watching the news. China, Ukraine, what's happening in the Netherlands, what's happening with farming, what's happening with energy, what's happening with heating, what's happening with the world. This guy, Michael Yon, is on it. And if you don't know who he is, let me remind you, you've probably seen him in one of these shows.
Michael Yon.
Michael Yon.
Michael Yon, a Green Beret turned independent blogger.
A great example of how to do things real, uncut, raw.
You, more than anybody, have warned America about this.
A journalist and America's most experienced combat correspondent.
Michael Yon says the media are missing the real story there.
Michael was one of America's youngest Green Berets. That's not an easy thing to manage at 19 years old. He is America's most experienced combat correspondent, not necessarily a title for the faint of heart.
As with Iraq, there's not a lot of journalists actually on the ground in either of these places. It's very difficult to travel around without, getting hurt or killed or kidnapped.
Did you see any men in black from the accusation from the question raised?
I was this close. I spend a lot of time with soldiers in the wars, and the men in black that I saw seemed more like special forces.
Within 24 hours, I was at the El Paso border with Mexico and watching the immediate influx of migrants after the inauguration.
Been watching food and energy and migration patterns very intensely since January of 2020 when the pandemic started. In every country that I go to, I want to know what the farmers think. I go straight to farmers. I want to know what people like truckers think, law enforcement, military, that sort of thing, the basic pulse of the countries that I go to. When you get a big famine or a big pandemic or a big war, you'll get a lot of POP, human osmotic pressure, that pushes people over borders and pulls people over borders. Panama is an invasion corridor to the United States, and there's huge numbers of people coming from about 150 countries through Asia and Africa and South America, and they come through Colombia, and then they head through that jungle called the Darien Gap. I've been warning about this for 30 months. Since January of 2020, I've warned of global famine, and right now it's coming to pass. Pandemic, famine, war, triangle of death, they always go together.
All right, it is my honor and pleasure to be starting out this brilliant New Year's with a discussion I've been wanting to have for some time with a guy whose boots have been on the ground, Michael Yon. Thank you so much for coming in today. I really appreciate it.
The opportunity to come here and speak. I was just watching your show. It's unbelievable.
Thank you. Yeah, well, I have such an amazing team. I know it takes a team. I know it's really about evidence, right? We can sit here and speculate, and there's so much that, when we do the work we do in the sort of the medical space, I have scientists all around the world. We are literally inside CDC. I've got whistleblowers no one knows about that are feeding me information. But there's so much that's happening in the news that I haven't gotten to put my feet there, and that's what you've been doing. And so I think to start, I know you can cover so many different topics. Let me bridge on a topic we have covered that is something that I've been seeing some discussions that you're having out there, which is sort of food supply. And based on this fertilizer issue, we saw how Sri Lanka basically is storming the capital. They're starving. They have farming problems, and we understand they were trying to turn them into organic, but that's not working out. And then the Netherlands are being denied, they're saying nitrogen fertilizer, you can't use it, it's contaminating water supplies. And then here in America, we're told there's a nitrogen shortage because of the Ukraine. So there seems to be a lot wrapped around nitrogen food supply, but you're out there. So from your perspective, sort of take me through what is the most alarming part of the story that we're watching in just snippets on the news?
Well, it's, or if you see it at all on the news, actually. Right. And actually, we're in a war right now. And so at times, as a war correspondent and previously as a soldier, often we don't have time for evidence and to analyze everything. You have to make intuitive leaps and jump ahead of it as best you can and work very hard to get things correct. And so I spend a lot of time out watching the migration flows as an example. This all feeds into the same thing, that human osmotic pressure, the push and the pull of migration, the hop, as I call it, right? We see our borders being overwhelmed right now. That's why I spend so much time down in Panama in the Darien Gap and down in Colombia, where I'll be back in a few days. I'm mentioning this because it goes into the fertilizers. One of the things that creates hop, human osmotic pressure, is war.
Human osmotic pressure, hop. Okay,
The
all right, very
push
good.
and the pull of migration, right? And so you can have a positive pressure from famine, a pandemic, war. And these things are conjoined. They're always enmeshed with each other, right? And so you'll find that the Darien Gap, this path between Colombia and Panama that feeds right up to the United States. I spend a lot of time, like I said, I'm going there in a few days again. I'm constantly out there with the Indians, Kuna and Imbra Indians. This is a pathway for Africa and Asia and South America to the United States. So normally the migration that we've been seeing is from like Honduras, Guatemala, that sort of thing, El Salvador, Mexico. But now the entire world is set up to be coming through the Darien Gap, right? For instance, when Mayorkas landed there, I got word that he was going there earlier this year. I got in position before he got there. I waited for him for about 3 days, and sure enough, he landed 3 Blackhawks right where I anticipated, and I filmed him landing. They're doubling the size of our camps to allow the migrants through. Now, back to the nitrogenous fertilizers.
Okay, but I know I'm going to slow you down, but we're doing this this is being done on purpose. There is a purposeful migration that's not only just South America, but to get people pouring into South America to come up and across our border.
Oh, clearly. In fact, Elon Musk, I think, brought it up last week on Twitter to a couple of senators, and Jordan Peterson, who joined me recently in Netherlands. I was on a show recently, and then he came over to spend a couple days with me. Jordan told Elon to pay attention to what I'm saying about this invasion. This is intentional. We could go on for hours. But we'll skip to the hop.
Okay.
The human osmotic pressure. We're clearly under food attack. We're clearly going to go into global famines. Now the question is, how are they going to unfold? For instance, let's talk about nitrogenous fertilizers like ammonia, urea, ammonium sulfate, ammonium nitrate, right? So they are created from a process called the Haber-Bosch process. The Haber-Bosch process. In the old days, we used to use guano for quite a while. That, for instance, the Irish used guano, and we believe that's what caused, or scientists believe that's what caused their potato famine. Some fungus on the guano destroyed their lumper potatoes.
Okay.
Right? So as we go into the turn of the century, of course, chemistry in the 1800s was coming of age, and in 1905, a German chemist named Fritz Haber, he wrote a book on thermodynamics in which he described how he could take natural gas, strip off the hydrogen, combine it with the nitrogen that we're breathing right now, and make ammonia, right? Which he did in 1908. So he published that book on thermodynamics in 1905, 1908. He got his moment where he had a little ammonia come out, but it was very difficult. So in 1913, another German chemist, Karl Bosch, came out, and he was a chemist that could actually bring this into action.
Okay.
So he was working at BASF over in Ludwigshafen, Germany. I've been there twice in the last year, and to specifically looking into this. So in 1913, Karl Bosch took the Haber's process and made it industrialized. So by 1915, Ludwigshafen, Germany, BASF plant was producing nitrogenous fertilizers and exporting those. And they're also great for explosives, right?
Right.
So explosives and fertilizers. So,
okay.
Of course, BASF likes to talk about fertilizer, but it was about explosives as well. So now, fast forward. Another 4 billion people today are said to be alive or believed to be alive because of these nitrogenous fertilizers and other improvements, if you want to call them that, in agriculture.
Okay. Yep.
And so these BASF is the biggest chemical company in the world. Biggest chemical plant is at Ludwigshafen, 10 square kilometers. It's unbelievable.
Wow.
And so there's plants all over the world now. For instance, Yara from Norway that produce these nitrogenous fertilizers. And so we can see that the natural gas, for instance, is under attack. I've been warning people all year long, if BASF goes offline, that is Europe having a heart attack and dying in front of you at your feet.
Okay.
So roughly 10 weeks ago or so, that's why when Jordan Peterson came to Netherlands and we spent a couple of days together, I arranged a couple of dinners. One night was with a scientist, and the next night was with a former CEO of a Dutch chemical plant, which is like BASF. And I asked him to explain to Dr. Peterson exactly the things that he told me. For instance, Europe is not exporting any nitrogenous fertilizers now, which means Brazil is not getting it. They're not going to get it from Trinidad and Tobago. They're not going to get it from China. They're not going to get much from us. They're going to be in a world of hurt, as is India. Thailand only creates about 8% of their nitrogenous fertilizers. They imported 5 million metric tons last year. I was with a Prime Minister of Thailand, former Prime Minister, a friend of mine, Abhisit, recently. I flew over there to talk with him about this. He says, Michael, you know, we export so much rice every year. And I was like, I get it, Mark. His nickname's Mark. But you create only 8% of your nitrogenous fertilizers. And when you're exporting rice, you're exporting nitrogen. Nitrogen sucks that nitrogen out and it's gone. And your soil is very weak in nitrogen. That's why you're pouring on, that's why you import 92% of your fertilizers, right?
Wow.
And so what are we getting to with this? What we're getting to is, you saw what happened in Sri Lanka. We're looking at that on a global scale, right? Now, when Nord Stream 1, BASF was, got their stock from Nord Stream 1, right? And so when I was...
We're talking about natural gas, because this is a product that is derived from and worked through natural gas.
Yeah, you cannot make these fertilizers from electricity. You can have all the nuke plants in the world and solar and all these things. It doesn't matter.
Okay.
You need the hydrogen from the natural gas.
Okay,
right?
got it.
Haber-Bosch process, one of the most important chemical processes in all of humanity.
Got
right?
that, okay.
And so you have to have the natural gas. So when I was at BASF, I was specifically asking, where do you get your gas? Nord Stream 1, right?
Right.
We remember President Trump warning the Germans about that, and the Germans laughing. But for those of us who track this, I was like, you know, you're giving the Russians your throat, right?
Right.
And now, naturally, something happened to Nord Stream 1 and Nord Stream 2. They were blown up. Who did that? Probably us. I mean, that's quite obvious. That was like cutting these arteries. Europe is going to die, right? Because BASF is now dead, right? They're moving operations over to China. Of the 29 plants in Europe that make the nitrogenous fertilizers, most of those are either closed or almost closed. So there's just not going to be enough fertilizer. So what's already created is mostly out there. There are other places that are creating nitrogenous fertilizers. We do, as an example. There's just not enough. Right. And we see many of these other disruptions unfolding right now. So what's been obvious, I've been warning about this since January of 2020. I was in Hong Kong covering the fighting there for 7 months. And then they finally kicked me out. They should have kicked me out after about 7 minutes because, let's just face it, I was part of the problem. But they finally kicked me out right when the pandemic was unfolding. And I'd been watching that. In late 2019, I sensed something was off. And I was unclear, but there was signal to noise issues there. Mm-hmm. And then in January of 2020, Steve Bannon called me. He said, do you think that there's a pandemic unfolding? I'm like, I'm not sure, but I'm actually buying masks. And I was in Hong Kong, right?
Yeah.
And but there's some signal there, right?
Yeah.
And then by February, it became clear. And back then, if you called it a pandemic, you would get kicked off of social media, right?
Right.
And so that was when I started telling people, stock up on food, because there are certain things that always run together. Pandemic, famine, and war, and human osmotic pressure. If you get a big war, you will always get famine, you will always get pandemic. There is no exception. If you get a big famine, you will always get pandemic, and you'll always get war. These three run together. I was doing an interview a year or so ago, and a lady said, you talk about this like you made it up. And I said, well, I did, because this is what I studied. And she goes, no, it's in the Bible. The 4 horsemen. I was like, oh, sorry about that. That's probably where I got it.
Right.
I forgot, because they knew it way back then. It's clearly in the Bible, the 4 horsemen. So people have known about this for at least 2,000 years. But for instance, famine. One of the things you always get with serious famine is epidemic typhus, right? Typhus that we mostly have wiped out through time, I think is going to make a comeback. So every day when I wake up and I'm doing my battle update briefing, my own private I'm watching for typhus cases, right? And I'm talking about epidemic typhus that's lice-borne, right? I'm not talking about the scrub typhus, but so there's So I'm watching these things, right? Because they always go together, and there are signals that you can watch and detect. And the bottom line is there's a lot of what I call SRD. By the way, there's no PhD program that I've found on pandemicology, right?
Right.
And there's none on faminology, right? I can't find any experts on famine.
That are sort of like, that are putting like the whole bigger picture.
There's no doctor of famine, right? And there's no doctor of pandemicology, right? And so there's a lot of virologists and epidemiologists and all this, but those are subcategories, right? Those are subsets of the skill sets that you need to understand what happens in a pandemic or a famine and how they entwine. Famine creates more famine, and famine creates pandemic. For instance, famine creates conditions. It's all about conditions, right? It's not about sparks. You'll often hear, I mean, every day you hear sort of an amateur question. I don't mean to say that in a diminutive way, but sort of an amateur question is, what will be the spark? It's not about sparks, it's about conditions, right? If you have a dry forest, any spark will do, and there's always sparks.
Right.
If you have I'm going to the jungle in Panama in a few days. If you have a firework factory explode down there, it doesn't matter. It's a rainforest.
Right.
There'll be a smoking crater, and there'll be no fire beyond a day or two, right?
Right.
And
the
so
spark doesn't matter. It's the condition.
All about conditions, right? And so famine creates conditions for pandemic. Pandemic creates conditions for famine, and they all both create conditions for war, and they both create they all create these the human osmotic pressure, the push and the pull of migration, right? And so that's why I study all of these things. And the mag daddy of them all is information warfare, right? That's the PhD level of warfare, is information warfare. I've written 3 books on it, actually. Unfortunately, they're only in Japanese because I've been trying to wake up the Japanese. They are being very heavily targeted by CCP information warfare and globalist warfare, you know, and the WEF, as they call it in Netherlands, the World Economic Forum. They're completely conjoined with China, with CCP specifically, right? They have, you know, of course, their Davos meeting will start in about 10 more days or so.
Right.
And I have somebody going over there, actually. I would love to go, but I have to go to the jungle. But they also have annual meetings in China, right? So everybody.
So this WEF, because we talk a lot about Klaus Schwab, this insanity coming out, all of our, you know, so many of our leaders, they're bragging now that they've basically put in place cabinets, Canada, France, you know, Macron, all of these are just sort of disciples of WEF. But you're saying that there's a real connection between WEF and China too, which, you know, is in some ways would be obvious because they don't hide these things. These aren't hidden meetings. They're very sort of visible with what they're doing.
They have annual meetings in China.
Yeah.
So, I mean, you can see Xi with Klaus Schwab.
Yeah.
And, you know, when it comes to, somebody asked me recently, is the Dutch government influenced by the WEF, as they call it in the Netherlands? I said, no, they're not influenced. They're captured. That is a captured government. You know,
what are they captured by? Like, what is it? Financial interest? Does WEF? You know, I always think of like the World Bank, the IMF. Like, is it you're not going to get funds? You know, to prosper if you don't do blah blah blah. Is that how this is working, or is it? Are there more details? I mean, how do they control a nation like the Netherlands?
You know, when you're trying to gain control over people, let's say for espionage purposes, there's something called mice, right? So there's money, ideology, coercion, for instance, videotapes, and ego, right? And this is how that they've, you know, gotten people around the world, is the mice, right? I mean, it's an old thing, it works, and everybody knows it intuitively, but that's what they call it in the spy world, mice, right? And so you'll see many people are just bought off. Some are coerced, others are ideologically driven, and others are just ego. They want to, you know, be out there on the forefront. Look at Trudeau. I mean, he looks a little ego-driven. Of course, he's there from his family, and he's also somewhat of not a highly intelligent man. He would be easy to dupe, right?
Right.
And so, but
well, and sort of like you also, because and just to sort of take it back a second, Nord Stream pipeline. You said you believe it's pretty obvious that America blew that up. I know we've been told Russia did it, or, you know, like to stop the supply, but sort of take me through that thought. Why America? And the thing, and sort of bring it around, I know to sort of focus this, here's what I keep asking myself, because I've watched this pandemic unfold. I've watched this vaccine that was so clearly a problem from the beginning. It was ridiculous. We knew it didn't stop transmission before any civilian got it outside of the trials. We knew it. It said it in the trials. How is everybody missing this? And then people, I keep arguing with people, like, this is all being done on purpose. They're reducing population. They're killing people. And I say things like, to do what? Be surrounded by people like me that didn't take it? Like all they want is a world filled of Deb Bigtrees, Aaron Series, Michael Yawns, or you know what I mean? That this is what you want the planet populate? It doesn't make sense to me. What also really doesn't make sense to me is how you could be raised in the United States of America. We're an international show, but we do carry ourselves with our own ego, right? The Americans have their own sense of we're the greatest nation in the world. How do people grow up in this nation, get into politics, and then get involved in, for instance, getting behind funding the movement of people into South America to infiltrate our borders, to dilute our education systems, our hospital systems, our food systems, you name it? Why would they blow up a pipeline that will hurt and create starvation and famine around the world, which will only affect us? We're all intertrade partners now, so we're going to go down and then what? Be vulnerable to some greater globalist system? What kind of human being could be raised here that would be, do they know they're doing it, or are they just total useful idiots?
Most will be useful idiots. The only cult that a person never sees is the cult that they're in, right? I've spent a lot of time studying cults after my Special Forces days. I realized how important that was to study things like this. And I infiltrated a cult actually in Sonoma, California.
Okay.
And tracked cannibals in India. That's sort of a whole different life. It was very interesting. Learned a great deal, and about cults and cult making, right? And you can see the World Economic Forum clearly is a cult, right? Mm-hmm. One of the indicators of that cult is just severe arrogance.
Right. Right.
It's over the top. But Biden and other members of our government specifically threatened Nord Stream 1 or Nord Stream 2. They threatened Nord Stream 2, which was pressurized but never flowing, right? Mm-hmm. And then of course there were the mysterious. Why would Russia blow up Nord Stream? They in Germany built it. Right. Russia would not. Russia, all Putin has to do is turn the valve and it's off, which he did. Right. In fact, the night that he did turn it off, I think, what was that, October 30th? I don't remember. I was up waiting. I was in maybe Netherlands or Germany. And I was watching the website, because there's a website you can watch the flows, right? And suddenly the flows went to zero. Putin said he would shut it off, which he can do. He can just make a phone call, shut it off.
Right. Right.
If Putin were going to do that, why didn't he blow up Yamal? Yamal runs straight from Russia through Ukraine and Belarus, right? There's different legs of it. Why hasn't he turned off Turkstream, right? I mean, there's other pipelines that he could hit, right? He hasn't done it. It doesn't make. Now, let me preface this with war never has to make sense, right?
Okay.
So one of the things about war, if you're trying to make sense, you're not making sense. That said, let me immediately go against what I just said, is that it doesn't make sense for Putin to blow up Nord Stream 1 or 2. Mm-hmm. In fact, it would be not only counterintuitive, but crazy.
And however, I would guess, just sort of following up, however this war turns out in Ukraine as it goes, he wants to get back to commerce, and that's a huge commerce flow, and now you've set yourself back from being able to deliver your goods. It just wouldn't make sense in some ways.
They put billions of dollars or euros into building Nord Stream 1 and 2, right? I mean, they had built Nord Stream 2 because Nord Stream 1 wasn't quite enough, right? And so, and again, Trump had warned them, and they laughed. The Germans laughed at Trump, and those of us watching this with a more, let's say, experienced and watchful eye, we're very cautious. And now we see in Germany, they're cutting down millions of trees. I lived in Germany for 4 years. I lived in Europe for 6 years. Ich spreche Deutsch. I speak German, and in fact, I just did a television interview in Austria only in German. So I'm kind of dialed into what's normal and what's not in Germany, right?
Yeah.
And they're cutting down millions of trees because they don't have enough energy to get through the winter, right? They've set up heating stations so that people can stay warm. It's unbelievable. After that, I shot over to Ireland and talked with Mary Lou McDonald. She's the head of Sinn Féin, far left group, pictures of Che everywhere. And I wanted to talk with her about food and energy. She'll probably be a future prime minister of, well, let me preface that with, usually when there's a famine, whoever's in charge is not in charge when it's over, right?
Right.
And I cautioned Mary Lou about the possible food issues ahead, and all she wanted to talk about was equality and equity and these sorts of talking points and migration. And I'm like, Mary Lou, food. You know, and she said what many of the Irish say: we export enough food for 45 million people. We have fewer than 8 million on the island. I'm like, hold on now. You got to calculate on the balance sheet here. We also have your inputs, right? Your energy imported, your fertilizers imported. You're not going to export that much food if you don't have it. And famine is endemic to Ireland, as it is to most islands. For instance, Japan has had probably 506 famines, maybe, found this in an old book, in the last 1,500 years. So, I mean, a lot of these, like, for instance, Japan imports probably, it's hard to say, but maybe 80% of its food. Likewise with Hawaii, right? What's Puerto Rico going to do, right?
Right. So
as these food shortages, usually in the past, when there's, except for, say, 1816, you know, there was the volcanic eruption in 1815, the Tambora near Indonesia, which caused global famine in 1816, 1817. But that was global due to the volcanic eruption. But you don't normally have a global famine. Usually there is actually enough food. It's just over there, right?
Right.
And sometimes your enemies interrupt it or something along those lines. For instance, the hunger winter in 1944-45 in Netherlands, that was caused by the Nazis. That was, and it only lasted about 6 months. Then we D-Day and that sort of thing, and we finished that off. Or let's say 32-33, the Holodomor in Ukraine. That was caused by Stalin, or Mao's Great Famine afterwards. You know, these were human-induced famines, right?
Right.
That's what we have going on now, right? It's clear. Often you'll have a hybrid. For instance, the 1845 pandemic, let's say a pandemic of potatoes in Ireland. You know, the fungus, if it was a fungus that got their lump of potatoes, the Irish were rendered weakened by the potato blight.
Yeah.
And then the English, not just the English, but mostly the English, you know, Ireland is surrounded by fish. It's an island, right?
Right.
Why weren't they fishing, right?
Right.
Because the English were stopping them. We had Americans trying to ship over food. The English were stopping it. Choctaw Indians sent over donations.
Right.
Even they were sending donations. I mean, and they didn't have a lot of money to be throwing around in 1845, right? And so, so that was human-induced, and that was a land grab. That's what's happening in Netherlands right now. For instance, I was down in Mexico watching the invasion earlier in 2002, or 2022, I'm sorry, and I saw the Dutch farmers were blocking the streets and starting fires. So I drove up to Austin and flew straight to Amsterdam and was out with the farmers in a few days. And I said, why are you blocking the streets? Why you got this fire here? And they started to tell me what's going on, right? And so I started going to their farms, and the farms are being taken away, much as Stalin did. You know, that was why they made the Holodomor. That's what that's what we're trying to do now with the Amish and so many others, with bureaucratic land grabs. That's what the Canadians are doing. So it's a comprehensive war. It's not just this fake vaccines that are clearly poisonous. They're clearly part. Okay, I'm going to go out on my intuitive limb that those fake vaccines are part of biological warfare, right? I mean, this is, to me, it's actually quite clear.
Yeah.
But I know it's your show, and I don't want to.
No, look. This
crazy,
show is about taking in opinions. You know, this is we triangulate what's going on. So, what's your perspective on it? Since you were, you know,
my perspective is that we're in a comprehensive war, and this population reduction is underway.
Okay.
You know, one thing that evil habitually does is tell you what it's going to do, right?
Okay.
Mein Kampf, right? Wrote it down, right? And did it, executed, right? So evil often will tell you exactly what they're going to do. They're crystal clear about shutting off the fertilizers, right? They don't hide it. Go to the World Economic Forum website. They're building smart cities. For instance, I was in one recently in Netherlands. It's a trial smart city called Brainport City. They're trying to build, the farmers in Netherlands own about 62% of the land, right? And the WEF, the World Economic Forum, wants to make a huge city called Tri-State City, right? And they call it Tri-State because it's mostly Netherlands, but also Belgium and Germany, right? So you can see the map. The World Economic Forum has the map, right? And so they need that farmland for starters. And you also want to get rid of the farmers because the farmers think for themselves. That's one thing that I get along with farmers in every country I go to, whether it's Afghanistan, out with Taliban farmers, they're all the same. They want to talk about the weather. They want to talk about the aphids. They want to talk about their family and the new water buffalo they just got or the new tractor, right?
Yeah.
They're easy to get along with. Like, I go out with these Indians in the Darien Gap in Panama. You look up the dangers of the Darien Gap. Those Indians murder migrants every single day. But I go out with them and I treat them like farmers and I get along fine, right? They're farmers.
Yeah.
What I'm getting to is when I saw farmers, for instance, in Netherlands blocking the streets, farmers don't do that.
Right.
That's what Antifa does, right? That's what, you know, other clowns do that have been wound up, right? I flew over there and I asked them, why are you blocking these streets? I know you got a busy farm to run. You're a businessman, you're a businesswoman. And because they're stealing their land. Again, that's what Stalin did. You steal the land and then you replace them with your own farmers, which can never do the job that the real farmers could do. And now you've got control of the food supply, right? Control the food, control the people, right? And so the mostly fake pandemic, if you want to talk about real pandemics, yellow fever, smallpox, tuberculosis, which is coming over.
This has a death rate, as we've reported, of roughly 0.026%. I mean, it's barely perceptible.
Like
the whole thing's imaginary. It's shocking. So when we talk about this famine, and you said that there's never been a worldwide famine, and you're saying there is famine coming our way. Will America be affected? Or are we insulated from that? I mean, is it end up being, is it going to be compartmentalized? Are we going to be one of those nations that say it's not here, but it's over there?
I think this time it will be here, and it has been here before. Actually, there have been famines in in America, let's say, before. I mean, even Jamestown in 1609, when my family landed there in 1610, they were starving, right? That was due to, they had a 7-year drought. And anyway, not to go into that, but bottom line is, we are not insulated against famine, right? Let's say we have been insulated when we had a reasonable government, right? When we had a responsible government that was actually looking out for America. We've got great waterways, we've got great railways and pipelines and tremendous resources, right? One of the things you'll find in the study of famine is that oftentimes the places with the most food are hit the worst, weirdly. For instance, Henan province in China, breadbasket of China was where famine was some of the worst there. Or say Ukraine. Ukraine itself is a breadbasket of the world, really.
Yeah.
That black soil and whatnot. Or some of the counties in Ireland, which were most severely affected, were some of the most highest produced. When I was in the Iraq War, Diyala province is the breadbasket of, it's near Baghdad, right? There was the Shia were trying to induce a famine among the Sunni. I was actually on a mission. General Petraeus is the one that keyed me up to go on this mission. We sent a battalion of striker soldiers over to this giant warehouse on the outskirts of Baghdad because the Shia that had the food that was produced in Diyala province would not release it back to Diyala province to the Sunni. And so the commander who was there, he pointed to me, he said, see that guy? He's got the camera. You're either going to be a hero for releasing this food tonight, or I'm going to arrest you, and you're going to be a criminal, and we're going to take you out of here, and we're going to take that food. One way or the other, you're either going to release the food, or we're going to physically take it right now. And he released it. It was he couldn't really, resist that very much. So we took about, I think, 80 semi-trucks that night, something like that. But that was a human-induced, that was an attempted famine against it wasn't allowed to occur because we were there with our military. And it was a Sunni Shia thing, right? So that was a Civil War type thing. And by the way, in Ireland in 1845 to 52, some people argue it was to 1850, irrelevant. But the Catholic and Protestant issues around that famine were tremendous. I mean, even now, I was just up in Belfast recently. They have over 20 miles of wall still. I mean, that place looks like Israel. It's like, it's got a proper wall, right? And more than 20 miles to keep Catholics separate from Protestants. But so what you'll have is in times of famine, your enemies, like for instance, the Protestants were trying to force conversions from from Catholicism at that time in exchange for food. You know, these sorts of things. When people are weakened, then these sorts of things come out. But now, as we see the food shortages, like for instance now, last year I didn't see many people from Peru coming through Darien Gap or across Mexico into Texas. This year I see Peruvians every day. And so when I started asking, why are Peruvians coming? I mean, I like Peruvians. Not a loaded question, but why are you here? And it was food, because they're having food problems in Peru, right? And so if you go down to the border today, we could do it today. And we could find Peruvians today at Eagle Pass, right? And ask them, why are you here? And they'll say, well, the food's too expensive. We can't afford it.
You mentioned this term SRD and then sort of went blaze. What does SRD mean?
SRD is something I've noticed in my studies of famine. Since there's no PhD study on this, I have to do it myself. And so autodidact this thing. And I've noticed that there's this SRD, substitution, reduction, and disruption, which always could be symptomatic or causal, right? Substitution is when the products that you normally like to get, say avocados, are not available, right? And so you substitute and you get something else. Not a problem. I mean, you're not hungry,
right.
But you keep substituting and then you substitute something else because now that's gone, right? So it's not, I mean, we're always substituting because different seasons, you know, maybe apples aren't in season or whatever, right?
Yeah.
But sometimes it's quite obvious that we're substituting a lot more than we normally do. Now, that's symptomatic. It doesn't necessarily mean you're going into famine. But if you take it into context, maybe it does, maybe it doesn't, right? It could be caused by other things.
Okay.
Now, the next is reduction. Like you'll see people I was just over in London recently, people talk about they're reducing their meals because they can't afford it, right?
Yeah.
So reduction can occur, substitution and reduction can occur because you just can't afford it.
We're hearing things like, you know, in England, deciding whether they're going to pay their oil bill or skip some meals. It's getting down to that in what we used to think of as first world nations. I mean, it is really shocking what we're watching the news. I mean, I'm saying to myself, have we just learned how to live on, forgotten how to live on this planet? I mean, I don't even understand how anyone is being reelected in England or Germany when you, like you said, there's no heating, there's no oil. I mean, you know, there's no, now I got to choose between food and whether my house is, what, are we in the same century? You know, we all in the same century? Or do we just go back in time?
Ukraine flags were flying all over London when I was just there, and all over Ireland, even as their prices in Germany as well, right? I'm like, listen, Germany, you're about to be very cold, right?
Yeah.
And it's only going to get worse as 2023 unfolds. Of course, this is complex, and so it's unpredictable exactly how it will unfold. But it's all about conditions, and the conditions are worsening, and this is man-made, right?
So SRD, we're at the R. So reduction, and then D.
Disruption. When it comes to this, substitution and reduction, that if you go back to Weimar Germany, you know, the hyperinflation and that sort of thing, which also led to famine, right? Even down in Austria, right? And so, so people were substituting because they couldn't afford it, and reducing because they couldn't afford it, hyperinflation. Now let's get to disruption. Now when people are hungry and they can't afford things, good people then turn to crime. They're not really criminal. I mean, they're feeding their family. They're hungry. They're just going to do what they're going to do. One Russian doctor calls it, you know, wolf behavior. I mean, at some point, which happens very quickly, you know.
Survival.
Yeah. I mean, people are going
Smart people have self-protective mechanisms too.
Right.
And when you're running out of food and someone just bashed in the window of a store and you see food there, you don't go, well, I'm a good citizen, therefore, and I'm a smart guy, therefore I'm going to just let my family starve.
You're going to answer the call of the wild. I mean,
right.
You know, and so now you get into disruption, and disruption creates more disruption. For instance, as people rob stores or rob trains, then they stop flowing. And one of the things that they do is called gleaning. When I was with Jordan Peterson out with a farmer named Jordan in Netherlands, Jordan, you know how tall those Dutch are, drink a lot of milk. Jordan said, Michael, they're starting to glean down the streets now. They're growing onions, and gleaning is an old thing, glean with a G, not clean, but glean. And it's actually in the Bible again. Gleaning is when people go and collect the crops that aren't completely harvested, right? Like Jordan said, about 2 to 3% of the onions aren't collected because they fall off the truck or they just don't get them out of the ground or whatever. And so the people come and they glean, right?
Yeah.
So he said he's never seen gleaning in his life until the week before Jordan Peterson was with me there. And he said because his parents and grandparents told him what gleaning was, that's why he knew what they were doing, right? And so
I actually heard the term when I was working, I think it was on Dr. Phil, it might have been the doctors. there's people in America, in terms of those gleaners, when they jump into garbage cans and get out like all the produce that's being thrown out of the grocery store, dumpster diving essentially, for produce and meats that's still good as far as they're concerned. They consider themselves gleaners. So it's the second time I've heard that term.
Yeah, and I think you're going to hear it a lot more now. In fact, I looked on YouTube for there's instructive videos now. Now, getting to the disruption aspects of gleaning, now normally gleaning as it is, say in the Bible, the Bible, I looked it up because people had told me, and you're not to harvest the edges of your field so that passersby or very poor people can collect those parts, right? And so, and Jordan told me in the old days in Netherlands, they didn't do the corners, right? And the edges as well.
Okay.
And so for that reason, right? And so, but now one of the things that happens when food is very short is, first of all, the government start raiding farmers. They raid the warehouses. They go door to door, governments. In every case, in every book I've read on famine, which is 22 books now, right, on famine. I just finished another and started another, and another 60 on pandemic, right? So that's 82, right? So these things are almost the same, pandemic and famine, when you study them. But when it comes to the gleaning, you'll see that people will start robbing the farmers. And often it's the government. The government always does it. And then the farmers go bankrupt, right? They stop farming, right? And so now, in that second season, it gets worse because the farmers aren't farming. And the people aren't transporting the food because they don't want to get robbed, right? And so so this is where famine can create famine, right? And then, of course, usually within a few months of a profound famine, like a serious famine, you'll get famine fevers. One of those is typhus, always. Typhus always runs with famine. That's why they call it famine fever, that and relapsing fevers, right? And also they call typhus war fevers because it always goes with war. And typhus always goes with big, like these homeless. These in Southern California, you'll see small typhus cases popping up now. I see it in my alerts, right? I use Google Alerts to track typhus, right? So they call it hospital fever. They call it famine fever. They call it war fever, ship or naval fever, camp fever, because when you get groups of people together that are not washing like they normally wash, typhus breaks out. It's endemic right where we're at here in Texas, right? It's just that we keep it under control now because we know that lice spread epidemic typhus, and we have the antibiotics to treat it. But what are we going to do when China? We can't get those antibiotics from China, and there is an actual famine. You asked to your question earlier. Will we have famine in the United States? Nobody knows the answer to that. But my guess at this point would be greater than 50% chance that some parts of the United States go into some sort of famine, like a real famine where people starve to death.
Wow.
Right? And this can be caused, again, that D and the SRD, disruption. When people start to, go crazy and burn things down, of course, old knowledge was...
Well, and obviously when you're saying things like that is bringing up images of what we saw happen in Portland. We are seeing crime rates like we haven't seen, I don't even know if in my lifetime. I mean, we're starting to hear, not since 1960 something, not since in these cities all across the country. And so, and homeless populations, everyone's talking about Austin, just miles from here, giant tent cities, and I remember I went to Haiti after the earthquake, and I'm thinking, we're starting to create these scenarios and see them in first world nations. So then I think about, you're saying war, like race, religion. It seems like every way they can separate us, we are. Whether, now it's not just your color, that's an issue, but also your religion, and now your sexuality is got to be questioned, and where do you stand on this? And so that we're becoming more and more divided, and in many ways vulnerable. Is this the goal, to take great nations like United States of America, the UK, Spain, France, whatever, and break them apart into just where we're just singular individuals struggling to survive? Is this how they end up making us a global system, that we forget our borders, we don't care about our neighbors now, every individual's got their own issues they're having to deal with? Is this part of what's happening here?
Clearly. Highest level of warfare, information warfare. I see in your studio you've got the book from Matthias Desmond.
Yeah.
I was in his home recently, last year, in Belgium. And he had a very important book that I've been recommending to people for years called Rape of the Mind. It came out in 1954 by a Dutch psychologist, Meerloo, right? I highly suggest reading that book, Rape of the Mind. Read it.
Okay.
And it's very important, and it lays out these, of all the dozens and dozens of books I've read on information warfare and studied it around the world. I've gone across Asia to museums in Nanjing and oh, good Lord, Malaysia, Indonesia, all over the place. And studying museum warfare is what I call it. I study information warfare because that's the highest level of warfare. They're clearly trying to atomize us. If you read Rape of the Mind, you'll see that
atomize us. It's a great term to help understand. So, all right, they. When we say they are trying to atomize us, what does they mean to you? Because this term, I've been saying we give a lot of power to the they, and I'm really not into being disempowered. Part of what the high wire is I want people to know how powerful they are. Together, we can do anything. They're trying to divide us. They're trying to make us argue with each other about every ridiculous part of our lives. The things that we used to count on as just fundamental are now being blown apart. If we can get back to our power. But when we say they, what does that mean to you?
I've seen you say that before, and it's a beautiful and very important question, asking who is they, because we empower the they that we can't see.
Right.
Now, to get to the answer to this, it's obviously a multiplayer game,
okay.
Right? So it's a jungle. Who runs the jungle? Well,
right.
They mosquitoes or they, the fungus out there. But clearly CCP is a world-class information warrior, as are we, actually.
Yeah.
And the Russians have been doing information war against us since the 1920s, and they're quite good at it, as have many others. So there's many theys, actually, right? Now, which ones are the most important theys right now? Clearly, World Economic Forum are the ones that are trying to disassemble our borders, which we effectively don't have any borders now. You were in Haiti after the earthquake. There's Haitians right now in the Dry Tortugas. I just got a message this morning from a prosecutor in Florida telling me about the Haitians that are landing in the Dry Tortugas, which is islands right off the Keys. They're beyond the Keys.
Okay.
It's a national park. We just closed it a few days ago because of this. So information war has empowered. If you say, well, we should have borders, obviously the World Economic Forum wants there to be no borders so that they can dissolve our unity, right? To atomize us in every way possible, whether it's around race or religion, which some of that is just natural anyway. It wasn't like the World Economic Forum made the Protestants fight the Catholics or the Sunni fight.
But governments fuel these things in order to try and
fuel it.
While you're fighting each other, you're not fighting us. And as we're robbing your banks, your farms, all that, just stay focused on each other. Someone once joked, I think it was about trickle-down economics for whoever's up, but I just remember the joke was, here's how this works. There's 12 cookies. The big guy comes in, takes 11 and say, hey, he's trying to take that cookie from you, and you just get everybody fighting over what's left as your governments or whoever run away and pillage what we have.
I learned so many lessons during my time in Special Forces when I was a very young soldier. When I was 19 years old, going through what we called the Q course, and then through later training, we learned the 7 phases of a U.S.-sponsored unconventional war, right? And one of those phases, the first few phases, are just, for instance, the CIA going in and determining what natural fault lines can we exploit, like the Montagnards in Vietnam, right? Who fights who here? Who's who in the zoo?
Right.
And, bring in the anthropologist and tell us where the wires go here, right? And then if the government itself decides to do something, finally they may call in Special Forces, Green Berets to go in and say, go with the Montagnards, or go with the Kurds, or go with somebody, right? And go with the Hazara people in Afghanistan, right? And so and our enemies do this as well. We learn this from others, right? So this has been done for
divide and conquer. That's right. Is it that simple? Is that the create division?
Conquer. It's that simple. Right? The Muslims call it fitna. Actually, fitna is a complex word, but the Muslims watching this will know exactly what I mean by fitna. And right now, what's being created is the most epic fitna in the world. They're trying to cause Sunni to fight Shia more now. We're seeing what's happening here, but I'm seeing what's happening in other places.
Yeah.
They're pouring on the gas, trying to get Sunni to fight Shia more, which there's always the fracture lines anyway. This tribe to fight that tribe. This isn't just the United States. It's happening in Europe. It's happening in Thailand, where I have an office trying to split Thailand into 3 different parts: the north or the south, the northeast, and actually Bangkok, and maybe 4 parts of this other northern part. And there's reasons for this.
And we have politicians here, do you believe, in this country, the United States of America, that believe in this ideal of breaking us apart for a better world, breaking down our borders? Are they going to enough WEF meetings that they're like, I like this idea, I like the idea of I mean, in this cult, what are they being sold? Here's my question, and then we'll try to wrap this up, because you're going to come back on. There's obviously so many things we could talk about. But in this cult, as you called it, the WEF cult, what are they selling them on? We had, just back a couple of years ago, we had a booming economy, right? We were all doing fantastic. We finally looked like under Trump, we, even this playing field with China. I liked trade restrictions, which I've been asking for even when I was a Democrat. But I'm not, saying Trump is great. I'm not a political show, but I'm saying we were lucrative, we were healthy, things were great. We were sort of ending wars, and now every single place I look, when you watch the news, it is like we have forgotten how to live on this planet. Our borders are gone. There are politicians, do you believe, in our government that truly believe and are working towards breaking us apart like this for some larger global agenda?
Oh, clearly. It's open. It's in the open. It's not hidden. It's back to the mice, right? For some people on the mice, it's money. For some, it's ideology. General Milley, I suspect for various reasons he's coerced, and for others it's ego, right? And that ideology and the money is clearly it for a lot of people. There's people like Bill Gates, who is buying farmland all over the place. The Bill and Melinda Gates Foundation has invested hundreds of millions of dollars into the picnic food distribution centers in Netherlands and other places. When I was in Netherlands, 3 of those facilities burned down. I went to one of them while it was still smoking. It's very interesting. So these food distribution centers are basically, he's got the farmland. They're printing meat over there with printers, literally printers. Right. And I went to a restaurant that does this. I didn't eat it, but I ordered it and made a video. And
they print it right there at the restaurant?
They didn't print it in front of us. It was quite gross.
Right.
And I'm somebody that goes out and eats with the Indians. And,
right.
I was out with Imbara Indians in Panama last year. They're like, you are like Imbara, because I'll eat anything they eat. And I'm like, you're like my grandparents, only more brown. Right. And they're like, yeah, those guys. But I mean, I'll eat anything in the jungle they'll eat, but I'm not going to eat printed meat, right?
Right.
I'm not going to. These synthetics obviously are well, like the quote unquote vaccines. There's something more going on here. But anyway.
So the burn down. They're burning down these food. Were they natural fires, or do you think that they're being?
It's suspicious that 3 burned down.
Yeah.
So obviously, everybody's thinking the same thing. Somebody must have caused this. And I've been told that there may be some, it's pretty obvious, 3 suddenly burned down. I mean, something's going on, right?
Yeah.
Actually, interestingly, on kind of a related but side topic, you'll see in famines, there's a lot of fires. Like if you read one book called Mao's Great Famine, thousands of fires. And difficult to explain, right? Some of the fires were caused or had known causes, like people working in a warehouse, the government warehouse, and there's only so much food they can steal on that moonless night. We get together, it's our family. We steal as much as we can steal, and then we burn it down to hide our crime, right?
Right.
Or the government officials do the same thing, and they hide their crime by burning it down. Thus, the other 98% of the food got burned down with it, right?
Right.
It's interesting. You'll see a lot of fires and famines. I've just noticed this reoccur in these many famine books I continue to read.
What's your hope? Let's empower the people here. I mean, obviously, I know I do what I do because I believe there's a better world in our future. I believe we still have the possibility, and I do it for my kids. I am fighting for my kids. I certainly will not accept where I see the WEF taking our world. I do not think what I've watched over the last few years in this country to be the best years of America. There's some of the worst I've seen, some of the most inexplicable corruption in government I've seen, whether it's controlling Twitter, Facebook, YouTube, people like you and scientists, everyone, censorship everywhere we turn, you know, using FBI, CIA to cover up stories. I mean, it's really bad. Now you got, you know, Bankman-Fried, you're watching financial interests that funded parties. Now, I mean, the whole thing just seems like so corrupt. And there, you know, clearly are these, whether it's useful idiots or not. What do we do to empower ourselves under these circumstances?
On a personal level, I've noticed both in war, I've been in quite a lot of war actually. None of us have been in huge famines because there haven't been any huge famines in our life.
I wouldn't know what to do.
China, right?
Right.
So that's why I'm reading so many books on and preparing for it, right? But teaming up is very important. Establishing your network. Like I know one veteran, a retired military guy in Texas, and he's like, I'm going to lead my community, you know, we're going to make it through this. And he sounds like this Japanese guy named Osuga in 1783. He did the same thing. He saw a famine coming, he got his community ready, and everybody made it through. But about 900,000 other people died in that famine. It's called the Tenmei famine, right? And then likewise in 1833, another guy named Kenjiro did the same thing in Japan. He saw it coming for various reasons, and he explained those like the eggplants tasted in early summer tasted like they were fall eggplants. They tasted very good. And he said, this is strange. Why are the leaves falling off the trees in early summer? He thought that there would be no serious summer. So he started telling people to plant millet, right? And in the Tenmei famine in the 1700s, Usugi got everybody to build fish ponds, right? And he was distributing a sort of survival manual in Japan, and it told people how to prepare and collect 73 different types of, I think it was 73, different types of grasses from the forest and that sort of thing, how to prepare them. Don't eat just rice because that's not nutritious. You have to mix it with other things. Grow ginger in your hedges around your fish ponds. People that this one veteran I was going to tell you about, he went to his church and he just made a spreadsheet of everybody's skill sets, right? And like this one lady, she's near 80 and she's a widow and she sees what's coming. She's very afraid. And he's like, don't be afraid. He's like, what are your skills? I mean, you have grandchildren. You have a lot of skills. You can't raise grandchildren without having, I mean, you ran a clinic and a restaurant and a psychological service for the family. And he said, and she's, you know, she knew how to can food, right? So that's we need that, right?
Right.
And so now what I need you to do is make a list of the pressure cookers that you need, the exact types, how many do you need, how many jars, the lids, the vinegar and the salt. You just make your list and be generous about it. Go heavy, and I will make it appear, right? And then you teach the children how to can. I don't want you to be the canner. I want you to be the commander of canning operations, right? Yeah. And so she's very happy. Now she has a job, right? Right. It's a very important job to teach young people how to can foods. So, I mean, you'll find, like in the 1700s with Usugi, everybody of the 900,000 people died reportedly in Japan during that famine, but nobody in his prefecture, right? Likewise with Kenjiro in the 1960s in Thailand, there was a protein shortage, and King Rama IX, great man, unlike his son, but King Rama IX, great man. He studied agriculture. I've been all over Thailand. You see his picture in villages everywhere where he's actually at that village, right? He's always out with the farmers, checking plants, and he studied, you know, water and these sorts of things. But he saw a potential famine coming in the 1960s. So he assembled a team, and he didn't quite solve the problem. So he contacted his friend, Crown Prince Akihito in Japan. And he said, hey, we got a protein problem here. What would Japanese do? And the Japanese and Thais are very close. And and Crown Prince Akihito said, make fish ponds, right? And so he sent over 50 Nile tilapia fish. And now apparently 40 of them died according to the story. And now if you go across Thailand now, there's fish ponds everywhere. Wow. And so you'll go on the menus, and just almost every restaurant you go to in Thailand, it's in Thai language, it's called pranil, right? And this fish is everywhere. And you ask the Thai children, why do you have this? Oh, the Japanese gave it to us, right? Wow. Because and you never heard of the famine in the 1960s in Thailand because it never happened. Wow. Because he warned. So people that see it coming, can prepare for it. And most famines don't last more than about 2 years. However, there are a lot that will last like 5 or 10, like the Irish famine that lasted arguably 5 to 7 years. But this one is clearly man-made. It's clearly systemic. It's clearly, like, for instance, when Nord Stream 1 and Nord Stream 2 were cut, that was cutting these arteries, right? So those nitrogenous fertilizers aren't going to suddenly appear now. Those plants are closed or closing, right? The smelting smelters across Europe are closed or closing. Factories are closing. So Europe is deindustrializing. And there's no bottom to this. There's not like they're going to go back to 1940 and stop. There's no telling where it's going to stop. And we see similar with China right now. Something clearly wrong with China.
Yeah.
This morning when I woke up, the first thing I did was check their air quality index to see, what kind of pollutions are coming out of China. They've still got a lot of air pollution coming out, so they must have a lot of factories open. But you can see, if you look at the shipping, there's just unbelievable numbers of ships parked off of China that aren't shipping. So, I mean, they're clearly China's economy is collapsing, and we are globalized.
Yeah.
It's not like, they can collapse and we're not going to, if you've ever rock climbed before, back when I was loving to do that.
Yeah.
If your protection isn't in right, everybody.
That's right. I'm a rock climber too. I know exactly what you're saying. We all go down.
Feels,
That's it.
And
so important. And so I guess, as I sit here and I think there are people watching the show, some that are like, that is crazy. Like, I'm going to have to learn how to farm. I'm going to have to learn how to do this. Yet, I will also say we've had Joel Salatin on this show, a brilliant farmer that's got great books like how to, micro farm and turn your yard into farm. We've had Food Forest here, and the homesteading space on YouTube is the fastest growing space there is. People that are turning their housing, their spaces, into farms. So,
that's
I think that's where we're at, right? It's getting to be a reality, and I feel like we have to. And here in America, man, we can really be complacent. Just look at Germany right now, totally screwed. Look at the UK. I mean, I have friends there that are like, we are freezing over here. This is crazy. What's going on?
It is. That's what we need.
Yeah.
The people like that are telling people and informing people how to make their victory gardens. Right?
Yeah.
But notice our government hasn't warned anybody. I haven't even seen a state government say, hey, grow a garden.
Yeah.
It's not like you can grow all of your food, but if many, many millions of people grow gardens, that reduces the stress enormously, right?
Mm-hmm.
And, the distribution is backyard table, right?
We are just, when you look at this, and I was saying on this vaccine issue, I'm saying maximum 5 years before we're microchip tracked, everything that comes along with like that spear, that's the tip of that is this vaccine program to get into tracking systems. Did you get it? Did you not? We sort of pushed that back. There was a worldwide pushback in many ways. Yes, a lot of people got the vaccine, but a lot of people woke up. When you're looking at a lot more different sort of diverse, systems that are all being manipulated around us, borders collapsing. How much time do we have? I've been saying for much of this globalist movement, this isn't going to be my kids. I'm not leaving this to my kids. I'm going to see this in my lifetime. We're going to see the results of the decisions we make right now. How much time do you feel like we have? How much time do I have to prepare for famine? And where do you see, if there's light at the end of this tunnel, how soon do we have to get there for it to be available to us?
Well, the world will keep turning, and the sun will keep shining, and the tides will come and go, right? The bees will keep doing their bee thing. In the 1840s, they call it the Hungry 40s, right? By 1848, you'll see there were about 50 revolutions started, roughly. So more than 4 dozen, right?
Mm-hmm.
There were physical revolutions. Some succeeded, many did not, right? But one of the things you'll find in famine is usually the government who's in place, and pandemic. Usually the government, that's why I warned that Trump probably wouldn't get reelected. Mm-hmm. And I was just going off historically.
Yeah.
And I was just like, well, I mean, people like him. He's more popular now than when he got in office. But if you follow this pattern mm-hmm. historically, the guy in charge usually isn't when there's a pandemic, right? And so my guess, based on historical readings, is that we'll end up in kinetic war here, as the situation is clearly worsening. But again, it doesn't mean everybody's going to die. It doesn't mean that at all, right? Everybody listening to this, everybody watching this, all of our families have been through wars, a lot of wars. All of our families have been through pandemics, endless. and famines. All of our
We're still here.
We're here, and now the people who tend to get through these are the ones who see it early and start to prepare your network, right? Because you're not going to get through as Rambo, right? It's all about networking. It's all about listening, the farmer that you had come on teaching people how to do things, right?
Yeah.
And you clearly are building a network. That's vital. Sharing information, sharing, I've got this, you've got that, I know how to do a roof, whatever.
Yeah.
We'll get through it.
Fantastic. Wow. As awesome as I had imagined, Michael, I love that you're out there. I love that you're in our network. We're going to lean on you more. I hope that you'll come back and join us and certainly report to us what you're finding out there. The media is shutting so much of this down. I want you to know that we have a growing audience. We're starting to bypass some of the media I worked for at CBS. We're here to bring the truth as we're finding, as we see it. So I hope you'll keep us informed of what you're discovering.
I hope you'll invite me on.
Absolutely.
Because I'll come on a moment's notice.
Okay. It's really a pleasure. All right, take care. Well, as Michael just said, it's all about a network. That is why, in many ways, I named our nonprofit the Informed Consent Action Network. We are people in action, making a difference in this world. We are a network. We are coming together. And part of what makes that happen is getting together in person. And it's something that I'm going to sort of bring to your attention a little more often. I do travel a lot. You hear about me speaking out there, but it really is important, not just to come see me speak, but to be with other people that are all coming to see events that I'm at, where there's other great speakers. And so just in the next month, here is where you can see me live speaking. Tonight, I'm going to be on Coast to Coast with George Norrie. That's a bucket list. I've done it once before, an awesome show. That starts 10 p.m. Pacific, 1 a.m. In the next day in Florida, where I'm actually going to be tonight. January 11th at 7 p.m. at the Battle of Trenton. This is going to be an online discussion about how we won in New Jersey against them trying to remove our religious mandate. That was an incredible moment. My life felt like we won the World Series. I cannot tell you, every time we text each other, everyone was there. Such a spectacular moment, screaming our lungs out all day long until we were finally victorious and kept them from making that vote. I still get chills, sometimes tears. Let's get it off before I get too choked up. An amazing moment. And then January 18th, the Greater Reset in Morelia, Mexico. There's also in Texas. I won't be at that, but there's a sort of sister event. But that's a great event. And January 22nd, Restore Freedom Rally in Orlando, Florida, restorefreedomrally.org. Those are all places. If you're in those spaces, you can definitely come and check me out and see the other speakers are there. One of the events that's coming right up is the Greater Reset. And it's a lot about what we've just been talking about. It covers all of the sort of different issues that are happening in the world. I'm going to be speaking there, and this is just a sense of what that's going to be like.
The Greater Reset is a 5-day in-person and online gathering where solutions-focused speakers and organizations share practical steps for individual and collective liberation.
This year, we'll even hear experiences from real communities on the ground across multiple continents.
The Greater Reset 4 will focus on activating 5 focus areas over 5 days.
January 18th, liberate your mind, body, and soul.
January 19th, permaculture and food independence.
January 20th, agorism and parallel networks.
January 21st, take back our tech.
January 22nd, building free and conscious communities.
This is our time to co-create the world we want for 2030 and beyond.
Join us as we lay the foundation for the next stage of a free humanity.
Join us from January 18th to the 22nd, 2023, as we gather online, in person in Central Texas and Morelia, Mexico.
Join us for the Greater Reset 4 Co-Creation.
View the full speakers list and organize your local activation hub at thegreaterreset.org.
It's literally an event designed at building your network, your community around you. I was asked, last year, why didn't you speak at the Greater Reset? I was like, I didn't even really know about it. Since then, I've gotten to be close with Derek Brose. We've interviewed each other. I've been on his podcast. He joins me now. So Derek, really looking forward to Greater Reset. This is an event that a lot of people talk about. Just really quickly, you know, what is the Greater, like why did you put it together, and what are the types of topics? We just sort of covered a bunch here, but it just feels like the pressure cooker's coming in from so many different sides, and community is so important. So what is it people will experience at the Greater Reset?
Yeah, thank you, Del. Thanks for having me on.
Yeah.
So I started with this project with my buddy John Bush in mid-2020. Yourself, myself, many other people, we've been reporting on all the problems. And once the Great Reset announcement was made by the World Economic Forum in June 2020, I don't know if you felt it, but I felt it. There was a lot of fear in the broader movements. People were like, "Oh no, we're going to own nothing and be happy. This is what they planned for us." And my buddy John and I, we started talking in about October 2020, and just really, we were looking at the fact that the Davos meeting was coming up in January 2021, and we just started talking, like, what are we going to do about this? Are we just going to watch their videos and obsess about it, write articles and talk about it, but basically just do nothing, you know, kind of react to it? And it didn't seem like it was enough for us. We're very much solutions, forward-thinking activists. And so we decided, why not hold an event? And this is, of course, right in the middle of many lockdowns and COVID mandates. Hold an event at the same time as the Davos crowd in January. So we held the first one in January 2021. We were live in 2 countries, Texas, the US, and Mexico, and basically bring together some of the brightest minds from our communities in permaculture. You were talking about food forest a moment ago. We've had Joel Salatin, we've had Jim Gale, people talking about mental, physical, spiritual health. We're going to have you speaking on that day this year. People talking about building parallel networks, homeschooling, alternative currencies. We have a day dedicated to digital technology to show people that there are digital tools that we can use that can protect us, our privacy, and empower us, that it's not all bad stuff. And then we're going to be hearing from homesteaders and people who are already living in communities, or who have their own land, or who are doing intentional communities, eco villages, things like that. And we did this January 2021, and it was a huge success from the beginning. I mean, with COVID and everything going on, we had 100 people show up in both locations, and that was kind of like, wow, people actually showed up, even though most people couldn't fly. And the reason I chose to do it in Mexico, besides living out here, is Mexico, as I'm sure you know, is one of only 2 countries that never required quarantines, tests, or shots to enter the country, and that's still the case in Mexico. And then obviously Texas was very free in a lot of ways too. So we did the first one in January 2021. We did another one in May 2021, and we decided to stick with the January annual event at the same time as Davos. So our 4th one, the Greater Reset Co-Creation, is coming up January 18th to 22nd. We'll be meeting at the exact same time as the Davos crowd, but instead of talking about, you know, how are we going to control the world from a top-down, centralized, authoritarian perspective like they come from, our event is very much focused on what you, the viewers, the listeners who are hearing this, can do in your own lives and your families and your communities and your churches and your neighborhoods to actually empower yourself. Because we don't think we should just sit around and wait till 2030 or wait till their vision comes to life. Instead, we believe we should be putting energy into creating our own vision for 2030 and beyond.
I love it, Derek. You know, we've met a couple of times, and as I've said, I've watched your interviews. There's a passion for quality of information that I think we share. And I'm really looking forward to this event. I'm looking forward to not only getting to speak, which is something I love to do live, but also to hear the other speakers, as I do believe this is becoming a critical time to start understanding how we're going to move forward. What are our special talents? We may not know all of those other, you know, the different things. Maybe I'm not going to be the computer specialist, my family, or the cryptocurrency, but somebody should be. And we should start figuring out who's going to carry what they can do and learn and get better at what it is we are good at. So I'm looking forward to that event. I'm glad you're doing it, and it's people like you that are making a difference in the world. It's part of what I really want to focus on here on the High Wire, and you know, other shows that we're going to be sort of putting together over this year, which is we can talk about what we're running from. It's really time now that we start representing what we're, you know, what you want to run to, who we want to be, and that's a real part of what I think you're involved in, and so I really appreciate that, and I'm looking forward to the Greater Reset just coming up here in a couple weeks. So people can still get involved, I guess. They can still get down there. There's room.
Yeah, absolutely. We have tickets for sale in Texas. So if you can't make it to Mexico or you prefer Texas, John Bush is going to be there hosting it with a bunch of awesome speakers in person. I know that we can announce that Zuby, who's going to be performing. And John, I'm going to take this from you. I don't know if you've said it publicly, but JP Sears will be there as well,
All
speaking
right.
in Texas, giving a short talk. And then, of course, Dell will be with us in Mexico and a lot of other amazing speakers. And I just wanted to mention one thing, Dell, that your last speaker, he was talking about the importance of that network. And that really is the core of what we're doing here. The Greater Reset itself is an initiative of the Freedom Cell Network that I helped co-found. People can find that at freedomcells.org, CELLS.org. And this is just a website that allows you to create a free profile. And then you add yourself to the map on the website. Don't put your home address, but somewhere near you. And this allows you to search and find people who are like-minded within 5, 10, 15, 20, whatever miles of you. You can search and find groups. You can search and find, individuals. You can look at their profile. Hey, look, they seem similar, like-minded. Let me message them. Then leave the website behind, meet in the real world, start creating real freedom hubs, freedom groups, pods, circles, whatever you want to call them. And we even have an Agora on there where people can list their services, their products, or if they're looking for an unvaccinated partner, they can list a dating ad, things like that. So we are really trying to help people see that there are practical solutions going on right now. We have grown the Freedom Cell Network now to 34,000 people all around the world. The Greater Reset itself is watched by 100. Last time I think we had at least 100 countries tuning in from different places.
Wow.
We had 12 countries represented in person. And we're by far not the only people doing it, but what we're trying to do is reach out to people like yourself and other great people who are doing brilliant things in their area and bring everybody together. 5 days of focused talks. Let's see what kind of solutions. This is one event, and you and I talked about this in our interview before on my podcast. This isn't about debating COVID, this theory or that theory, or even just talking about the problems. Obviously, we're responding to the problems, but the entire event and the focus of the Freedom Cell Network and the Greater Reset activation, we call it an activation because it's about inspiring, motivating, activating people. It's not meant to be a passive thing. So I know a lot of people follow your work and they're very informed, but they might be looking to find other people in their community. They might be looking for solutions. I want to invite you, if you can't come in person in Texas or Mexico, the event is also totally for free, 100%, no registration, nothing, at thegreaterreset.org. During the event, you'll see the screen pop up. It'll be live. We're also going to be publishing Spanish translations of all the talks. We're really making an effort to make this an international event because I believe that this is what is necessary at this really crucial time in our lives.
I totally agree, and I'm looking forward to being part of it. Thank you for not just, sitting back and worrying about the world, but stepping up and making a difference. That's how we're all going to do this, and it's inside of every one of us. I truly believe that it's time for us to step into why we're on this planet at this time. Derek, I'll see you in just a few days. I'm looking forward to it, and thank you for joining us and talking about Greater Reset just for a moment.
Thank you, Del. See you soon.
All right, take care. All right. Well, look, there's only one last thing I really want to cover here, and that is the fact that what makes this show possible is arguably the greatest, executive producer the world has ever known. I can't even say enough about Jen Sherry and what she's done. Left CBS, took a risk, was winning Emmy Awards, and said, you know what, Del, I love what you're doing. We had a dream. We would sit in our cubicles next to each other dreaming about, can you imagine what we could do if we made television the way we wanted to make television, where we weren't being controlled by the advertisers that were on our shows? And so a lot of this is that dream come together. Jen and her family went through a serious tragedy over the holidays. On Christmas Day, their home caught fire here in Texas. It was really horrific. That's literally the neighbor catching it burning. They lost their cars that were parked there. The fire ripped through the entire attic of their house, which means the fire department destroyed, with the water and the smoke and the damage and everything is basically a total loss. Those of you who've been watching this show long enough know that I have been through this. My family lost our home in Malibu. And I can say this, when you're in that situation, you need help. Your insurance never covers all of it. And especially when you have to rebuild your house. We left our house and moved to Texas, so I didn't have to deal with having to rebuild that home. Their whole family is displaced from their home right now, renting a home. And I am going to tell you this, I need Jen Sherry focused. I need her helping me make the high wire everything it can be. I don't want her to have to worry about, where the fundings come from, what difference they can make. So this is an opportunity where you get a chance to maybe, help bless this beautiful person that makes this show happen for all of us. We have a Give, Send, Go page up supporting the Sherry Perry family. There it is. It'll also be in all the links provided to you. Help us make a difference in her life. Just, you know, every little bit counts. It really does make a difference. And as I said, we can't do this show without Jen. She is still here today, even though she's buried, literally trying to dig out items and things that matter to them. So it was not the same Christmas that I certainly had with my family. So maybe we can shine a little bit of light in the Sherry Perry family direction. I want to thank all of you for joining us here in the new year. We are going to be having deeper, expanded conversations going on. There's so much we want to do. Legally, we are hitting the ground running in so many different spaces. I want to bring down vaccine mandates as we know it. I want to end liability protection. We're going to make that happen. Our legal cases are stacking up, and we now have the evidence, and we have these specialists stuck on camera admitting the truth. We're going after them. I need your funding to make that happen. We'll see you in this battle for the truth, for our lives, in building our networks and our community. We're going to be doing that every week on the High Wire. I'll see you talking about it more next week.